What's up, freaks? Here we go. Where the hell is it? Oh, yeah.
Pediatrics.
That's how
What
it
kind of patients do you
starts.
see in
There's no
Ms. Lowe,
extra.
did you ever have an occasion to treat a patient by the name of Laila Daniel?
I did.
Okay. Your Honor, at this time I move into evidence states 173, which is a complete copy of Laila Daniel's medical records from Children's Healthcare of Atlanta, encompassing her entire life, and as well as states 174 through 181, which are medical records specifically pertaining to the visit that she had with Ms. Lowe.
Ruben.
Ms. Lowe, do you recall the specific date that you treated Laila Daniel?
I mean, no.
Okay. But do you need to look through? Let me ask you this. Do you have an independent recollection of this visit? Do you have any independent recollection of this visit as you see her today?
I mean, I remember the child, I remember the visit, but I don't remember the exact date.
I can show you states 174 if that will help you. Do you recall the day that Laila Daniel came in to see you?
Yes.
And what day was that?
October 19, 2015.
And do you know who brought her in?
The foster mother
And do you know the foster mother's name?
is Jennifer Rosenbaum.
And what was the reason why Laila was brought in to see you on October 19th?
She came in for a leg injury.
Did you receive any sort of history from Ms. Rosenbaum?
I did receive history.
Yes.
Okay,
What was that
so
history?
she reported that she had been at gymnastics and had fallen and then had been unable to walk after gymnastics, and that she had been at her maternal grandmother's a couple of days before, and the report was that she had fallen in a hole. And then she had perhaps re-injured her leg when she had fallen at gymnastics, but since she'd been in gymnastics, she had not been able to walk on that leg.
Okay. So just so we can get the timing correct, did she indicate when the fall at her great-grandmother's house was?
She had said the fall had been a couple of days prior.
And then the fall at gymnastics, did that occur the same day as the visit or a different day?
It looks like from the note that it was she'd fallen off the bar a couple of days later and won't walk, but it doesn't say on the note if that was the same day or prior.
Did you do an exam of Laila when she was brought in?
It did. So it's an urgent care center, so we do a pretty focused exam following.
Sorry, what do you mean by focused exam?
So what the patient tells us is, or what the parent tells us is wrong with the child, we do a directed exam at that area.
Can you give us an example?
So she came in reporting that her leg was hurt and she was limping, so we direct most of our attention at her leg.
And so what kind of exam do you do when a child comes in with that kind of complaint?
So we overall look at the child and then palpate the extremity that is involved, watched her walk, and manipulated the leg and then ordered x-rays.
What were your observations for Laila's visit that day?
It was a long time ago. She looked like a 2-year-old that was limping.
So you said you ordered x-rays.
Correct.
Now, did you have an opportunity to review those x-rays yourself?
Yes.
Okay. Are they also examined by somebody else?
So most of the time they're also examined by my attending in the urgent care, and then they're read by a pediatric radiologist at Eggleston.
And is that done electronically?
It's done electronically.
We've heard a little bit about Eggleston. Where is Eggleston?
Eggleston's in Decatur.
And so a radiologist up there will read them?
Radiologists up there will read them.
I want to show you what's been previously admitted into evidence as States Exhibit 176. Do you recognize States 176? It's behind you.
Oh, okay. Yes.
And what do you recognize? What do you recognize that to be?
So it's an X-ray of her right lower leg, and she has a fracture just below her knee at the top of the tibia, and there's a questionable bowing fracture of the fibula, which is the other lower leg bone.
So none of us are doctors in here. So if you could kind of tell us, if you wanted to use this, there's a laser pointer on there. If it'll help you.
So right there's a fracture, and it looks like this top part of the tibia is compressed a little bit, which when you fall quickly into a hole is what would happen.
So you thought that the falling into the hole could have contributed to that?
So yeah, falling into the hole and then re-injuring it if she's falling off a bar at gymnastics.
Let me ask you this. Given the history that was provided to you by Ms. Rosenbaum, did you have any concerns at that time about child abuse?
I did not have concerns about child abuse. I was a little bit concerned that maybe the child had been neglected when at the grandmother's house to allow her to fall in the hole, but felt that she was in safe care with the foster mother, so she was not in any imminent danger.
But if I understood you correctly, you thought that it was the sequence of events that made sense as far as this particular injury, correct?
Correct.
What kind of, and we can have the lights come up at this point, thank you. What kind of treatment do you do for this kind of fracture at the urgent care?
We would put her in a splint and then have them follow up with an orthopedic doctor.
So you don't do casting there?
We don't do casting.
Do you recall if Dr. Eames actually observed the x-ray in this particular case at the time?
I don't recall.
Did you ever receive a call from any other doctors in this particular case?
I received a call from the orthopedic doctor a couple of days later. I guess he was agitated, not happy about the child, and he had sent the child up to Eggleston for evaluation, I believe, after he'd seen the child.
Did you ever have any further involvement in treating Laila Daniel at any other point in his life?
No.
Nothing further this time.
Thank you. Ross?
Good morning.
My name is Corinne Muller. I have just a few questions for you. If I don't speak up loud enough, please let me know if I'm not clear. You diagnosed Laila otherwise as healthy and well-nourished, correct?
I didn't diagnose her as that, but she appeared to be healthy and well-nourished.
She appeared to be healthy and well-nourished.
Correct.
In fact, you noted that. You noted she was well-developed and well-nourished.
Correct.
And you didn't make any notation with regards to abuse or anything of the sort?
No.
Thank you. I don't have anything further.
Nothing further.
All right, thank you. Any discussion? Any objections? Any excused?
No, Judge.
Okay. And you're excused. Mr. Chase was for you.
Raise your right hand. Do you swear or affirm that the testimony you shall give in this matter will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
You can put your hand down, take a seat, take a seat.
Thank you.
Can you please state your true and correct name for the record?
My name is John T. Eanes II.
Can you spell your last name for us?
E-A-N as in November, E-S as in Sierra.
Sir, how are you currently employed?
I'm employed from the Children's Healthcare of Atlanta as the medical director for utilization management and case management.
Okay. And how long have you been in that position?
3 years, sir.
Prior to that, where were you working?
But prior to that, I was working at the urgent care system for children's at the Hudson Bridge.
How long were you at Hudson Bridge?
Oh my, at least 3 years, I believe. I'd have to look back at that. I'm sorry.
That's okay. Were you working there in 2015?
I believe so, yes.
Tell us a little bit about your educational background.
I'm a medical doctor. I was trained at the Virginia Commonwealth University in Richmond, Virginia. That was my undergraduate. Then I went through the military and went through the Uniformed Services University of Health Sciences in Bethesda, Maryland. Then did internship at William Beaumont Army Medical Center in El Paso, Texas, and residency at Walter Reed.
And how long have you been a pediatrician?
Let's see, 96. 96 was when I graduated medical school, completed residency in 99, and I've been a pediatrician since.
And how many years were you in the urgent care type setting?
I would have to look back because I was doing it part-time for quite a while, so it was at least 6 years, I believe.
Did you ever have an opportunity to treat a patient by the name of Laila Daniel?
Yes, sir.
And do you recall the date that you first treated Laila Daniel?
I have to look back exactly. This is the record here.
Sure. Or I can provide you with states 173.
It was 173. Yeah,
Provide you with this.
yeah. That had the dates that she was actually. You have to forgive me. I didn't recall the exact date.
That's okay.
This was the consent form. Make sure this was mine that I saw. I apologize. This is her account. Was that the 426 appointment? Hold on. There's a couple of counts. I just want to make sure I'm looking at the right record before I say the exact date. Where is my note? Hold on one second. There it is. This would have been, oh, no, that was the second encounter. So that was date 10/19. So this must have been 6/13, I believe.
So June 13th, 2015?
I believe so. My apologies. I didn't memorize the dates.
That's okay.
That is correct. 6/13.
All right. And where were you working on June 13th?
Hudson Bridge, urgent care.
And who was Laila brought in by?
It was a foster mother, if I remember the name correctly. I've got to look back here and see. Let's see, what is the mom? Patricia Lambert. Is that correct?
And what was the reason why Laila was brought to you on June 13th, 2015?
She had been vomiting at the time.
Did she give any more information about the history of vomiting from that day or the days leading up?
It had been indicated there were numerous episodes of vomiting prior to the foster mother picking the patient up, but and had one additional episode after she picked her up, but no other symptoms.
Okay. Were any the medical history, was any sort of medical conditions provided to you as part of the medical history?
They denied any other medical history, although they did indicate that the child was in foster care for maternal meth use.
Was there any mention of any previous physical abuse to the child?
No, sir.
Now, what did you do as far as a physical exam of Laila on that day?
It'd be a focused exam looking at heart and lungs, abdomen, a general look at the skin, the head, eyes, ears, nose, throat.
Okay. And did you make any notes regarding the height and weight of the child?
We had a weight of 10.6 kilograms. I don't believe we did a height that day.
And is that within normal range?
I believe so. I'd have to look at the growth chart, but typically, yes.
Did anything appear to be abnormal as far as her nourishment that particular day?
No, she seemed to be doing quite well.
And what else did you do as part of your exam?
The head, eyes, ears, nose, throat. We just kind of look at all her parts around her head, her chest, abdomen, expose and examine her abdomen, make sure there's no evidence of any serious illness.
Okay. Now, when you looked at the abdomen, did you note anything unusual about the abdomen?
No, not on the exam.
If you had, would you have noted it?
Typically, yes.
I want to show you State's Exhibit 45.
Okay. Is this that picture?
That's that picture right there.
Yes.
Use the top picture right there. The area underneath the belly button, did you observe that hypopigmented area when you examined Laila Daniel?
No, sir.
Had you have observed that, would you have noted it?
That's a significant discoloration, so yes.
It's simply asking if that's something that he would have, if he had seen, he would have made sure to include in his records.
Actually, go to rule.
Yeah. With that discoloration, that would have been commented on, just because it's an unusual type of hypopigmented area.
As a pediatrician, is it part of your training to identify potential signs of child abuse?
Yes.
And what kind of things do you look for when you're evaluating potential signs of child abuse?
Unusual physical exam findings, bruising, pattern bruising. It's kind of a spectrum of things. Some of the symptoms can be subtle, so you've got to look for different items.
And when Ms. Lambert brought Laila in on that day, did you have any concerns about potential child abuse on that day?
No, sir.
Thank you. Doctor, and you have a copy of the medical records. Was Laila ever seen at Children's Healthcare of Atlanta on August 12th of 2015?
Not for the records.
Did you ever have, any other contact with a medical case involving Laila Daniel?
I had a contact later as a supervising physician for physician assistant.
So tell us about that. Tell us about how that supervising physician works regarding physician assistants.
When the urgent care facility, the physician assistants will do a lot of additional help for the providers, and we just review the charts for completeness and make sure that the documentation appears appropriate.
And do you recall the date of the visit that you reviewed the chart?
That was on 10/19.
And who was the child seen by on 10/19?
I believe it was Tina Lowe, if I remember correctly. Let me double check here. Yeah, Christina Lowe.
And what was the reason why she was brought in?
Let me look back here real quick. A leg complaint, not weight bearing, and now limping on the leg.
And did you actually see Laila Daniel that day?
No, sir.
Is it common for you to not see the patient when they come in if they're seen by another provider?
If the physician assistant feels comfortable with the case, yes, we won't see them.
What about the x-rays? Did you see any of the x-rays on 10/19?
No, I did not. I just review the reports.
Did you ever see the x-rays?
Yes. A couple days later, we received a call from the orthopedics expressing concern about the x-rays, and then we saw.
I don't think she's really said it. This simply goes to why he looked at the x-rays. Well, not our matter, sir. It simply goes to why he went back and started looking at the x-ray.
It's in this portal.
Sir, you can continue.
A couple days later, we received a call from the orthopedics expressing concern about the x-rays. At that time, I reviewed the x-rays.
Okay. And when you reviewed the x-rays, did you have any concerns yourself?
It was an unusual fracture.
I'm showing you was previously submitted to State's Exhibit 176. Doing it a little for us here, okay? You said it's an unusual fracture. Tell us what you mean by that, and I'll hand you a laser pointer, if that might help you explain to
Either
the
way.
jury.
Oops, make sure I know what I'm doing before I shoot anybody. There. Yeah. The area of fracture is very close to the knee itself, which requires an enormous amount of force. And so when I would see a fracture like that, the other risk is to the growth plates themselves. So this would have been a fracture we would have recommended talking to the orthopedic doctor about.
And why? So you say that it's it would have required an enormous amount of force.
This is a thick portion of the bone, so it's not something you just simply break per se. You wouldn't break it by a simple fall, or it'd be something you know that there was an injury at the time.
So a simple fall would not cause this kind of fracture.
Correct.
What about pain? Would this type of fracture cause pain?
Easily.
How much pain?
A lot.
Would it be the type of pain that would be immediately known to the child?
Correct.
What about those around the child?
Easily.
Now, from this X-ray, can you tell anything regarding the timing of when this injury could have been inflicted?
The exact time you wouldn't be able to decipher. However, it's a recent injury. It occurred very shortly.
And in layman's terms, could you give us, a range?
I would expect within the last day.
Now, you had mentioned that you had spoken to the orthopedic doctor, correct?
Correct.
After speaking with the orthopedic doctor and looking at this X-ray, what, if anything, did you do?
Well, there was a couple things. The orthopedic doctor expressed concerns, and we recommended, if he was concerned about the injury, to refer to the ER or try to help. The other thing that occurred in this is I contacted the physician assistant because I was a little concerned about the X-ray report to see if she had additional information not documented in the chart.
Okay. And did anything that you learned from her, and you don't tell us what she said, but is there anything that you learned from her that that affected your opinion or caused you any additional concern?
She had made some additional comments supporting the case, and I had indicated that these needed to be documented in the chart.
Did you call DFCS or law enforcement or anything of that nature?
No, sir. I wasn't directly seeing the patient, so we made recommendations to the orthopedics if they were concerned, but that's all we did.
Thank you.
Ross.
Briefly, Dr. Hughes, my name is Corinne Wall. I just have
Nice to meet you,
a
ma'am.
couple questions for you today. Please let me know if I'm not speaking loud enough or you can't
Oh,
understand.
absolutely, ma'am.
This injury was documented in your office as an injury consistent with accident, falling in a hole, and then falling in gymnastics, wasn't it?
That's what was reported in the chart, correct.
Thank you, that's all I have.
Thank you, ma'am.
No, sir. All right, thank you, Doctor.
Thank you. Do you want me to leave these here, sir?
Mr. Chase, do you have any direction for this witness as to what to do with these exhibits?
Oh, I think
Thank you, sir.
And your excuse, unless you're
none from Dave.
Okay.
small, the doctor be excused?
Yes, Your Honor.
All right. State calls next witness.
State calls Dr. Sean Duxbury.
Dr. Sean Duxbury. Right here, please, sir.
Please raise your right hand and be sworn. Do you raise your right hand for me? Do you swear or affirm that the testimony you shall give in this matter will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
You can put your hand down. Please state your true and correct name for the record.
Gilbert Sean Duxbury.
You just want to probably talk a little bit closer to the mic.
Gilbert Sean Duxbury.
Can you spell your name for us?
Gilbert Duxbury.
Sir, how are you currently employed?
Currently, I'm on a hiatus between two jobs. I was at Texas Children's Hospital. I'll be starting at University of New Mexico in a month.
And what are you going to be doing at the University of New Mexico?
Pediatric orthopedics.
And what were you doing at Texas Children's Hospital?
Pediatric orthopedics with an emphasis in spine surgery and trauma.
And tell us a little bit more about your educational background.
I went to medical school. I went to graduate school at Georgia State. I went to medical school at University of Alabama, Birmingham. Then I did my residency at Atlanta Medical Center,
And what was your residency in?
orthopedic surgery. And then I did a pediatric orthopedic fellowship at Emory, based out of Eggleston.
Now, tell us a little bit more about the pediatric orthopedic fellowship. How is that different than just general orthopedics?
Dealing with just kids and pediatric orthopedic problems. So instead of adult fractures, adult orthopedic problems, dealing with pediatric specific only children.
And are orthopedics related to children different than the orthopedics related to adults?
Yes,
Can be.
they can be.
Okay. Tell us, do you have any medical licensures or certifications?
My medical licensure,
Yes.
I'm licensed in the state of Georgia, I'm licensed in Texas, and I will be licensed in New Mexico in a few weeks.
Do you have any teaching positions, or have you in the past?
I'm an assistant professor at Texas Children's Hospital, and I'll be an assistant professor at Georgia State. Oh, I'm sorry, at New Mexico.
Have you ever done any research in the field of orthopedics?
I have.
And just tell us a little bit about that briefly.
Mostly in spinal deformities, but I've also done, when I was in medical school, some research into orthopedic trauma.
Your Honor, at this time I would move to tender Dr. Duxbury as an expert in the field of pediatric orthopedics.
He's been for that purpose by the court.
Thank you, Judge. Dr. Duxbury, I first want to talk to you about a certain case. Did you ever have an opportunity to treat a patient by the name of Laila Daniel?
I did.
And do you recall the date that you treated Laila Daniel?
I do not recall the date.
Your Honor, at this time I move into the record, the medical records associated with Dr. Duxbury's treatment. There is a corresponding business record certification that's self-authenticating.
And
We're going to show you State Certificate 182. Would this help you with some of the details?
Yes.
Okay. If you could tell us the date that you treated Laila Daniel.
I saw the patient on October 20th, 2015.
And do you have an independent recollection of this particular visit?
I do.
And why is that?
It stood out to me because I was very concerned that it was a non-accidental trauma case.
What was the reason why Laila was in your office?
She was brought to me because she had been seen the day before, I believe, by one of the Children's Healthcare of Atlanta urgent cares who had referred her to me for a lower leg fracture.
And when you got the case, did you also get the X-rays that were associated with this particular case?
I did.
And did you have any concerns when you looked at the X-rays?
Not just from the X-rays, no. Although it was somewhat of an unusual fracture pattern for somebody the patient's age.
So it was the fracture pattern. Tell us a little bit more about why that was concerning to you.
It was a complete fracture of the proximal tibia, which requires a fair amount of force to generate, usually more force than somebody that's the patient's age can generate.
Let's back up and this is not working at the moment. See if that'll fix that. But let's back up and talk a little bit about the history. Were you given a history regarding how Laila injured herself?
I was.
Well, let me ask you this. Who provided that history?
It would have been the foster mother.
And do you have a name for the foster mother?
I don't recall the name.
Is it in the records that have been?
It is. It is. Jennifer Rosenbaum.
And when the patients come and see you, do they actually fill out a form regarding the history?
They do.
And is that included in those records?
It is.
I can see that back from you. Turn back in public. So to do an overview real quick. The section over here on the left, this section, who would this have been filled out by?
That would be filled out by the guardian of the patient.
And in this particular case, was that signed by someone?
Yes.
And the signature right here?
Correct.
Now this section above it, in here that I'm pointing to, kind of on the right, who fills out that?
That's filled out by one of my assistants in clinic,
And where do they get that information from?
directly from speaking with the guardian.
So based upon the history that we see here today, or we see on this form, I should say, what was the history that was provided to you regarding how this child injured himself?
The history that was given was that initially the patient had been playing at her grandmother's house and fell into a hole, injuring her leg, and then subsequently the next day at gymnastics had fallen again and injured herself, the same leg.
Now, did Ms. Rosenbaum provide specific dates in this history?
She did. She said the first occurrence was on October 15th, and the next occurrence was on October 16th.
The October 15th, what did she say caused the injury on October 15th?
She said that she had stepped into a hole, I believe.
And this, the October 16th, what did she say happened then?
On October 16th, she said she lifted her leg for a pike and fell.
Are you familiar with that term is a pike?
I think I know what a pike is.
Okay. Did she also write anything regarding the child's history, did she write anything herself regarding the child's history?
No. She stated that that the patient was the second of 3 children of 3 pregnancies, that she didn't have any major illnesses, no operations, no medications, no allergies to medications, and she stated that she was adopted.
Now, what does it say underneath adoption?
History of abuse.
So you indicated that she had actually been to Hudson Bridge prior to coming to see you, correct?
Yes, sir.
Is that pretty standard procedure for them to go to the urgent care and then come see you?
Yes.
So let's look at the x-ray in this case. The laser pointer, I think, is still up with you. Right there. What are we looking at, and I guess what caused you concern based upon the history that you received?
So this is your knee joint, and it's looking at it from the front of your body. So this is the end of the big bone in your upper leg, and these are your 2 bones in your lower leg. So this is called the proximal tibia, and this is called the distal femur. There is a complete proximal tibial fracture, which comes through this part of the bone is called the metaphyseal bone, that comes through the metaphyseal region of the bone. Complete meaning that the fracture goes all the way across the bone, that if you took this bone apart, these 2 bones wouldn't be attached through the fracture at all.
And the history that was provided to you, did that seem consistent with the injury that you were observing on x-ray?
So possibly, if she stepped into a very large hole going very fast and fell, but that would make it, but it's unlikely still that she would have that fracture pattern.
So if you fell in a large hole at high velocity, it could be possible but unlikely. Is that correct?
It could be.
What about falling off the bar or beam in gymnastics?
Most likely not, depending on how high the beam was. If the beam was 5 or 6 feet off the ground, perhaps.
What if the beam was only a couple feet off the ground?
No.
That would not. This fracture would not be possible.
It should not be possible. She shouldn't be able to generate enough force to cause that fracture. And I don't know how much I'm allowed to. If she had had this injury the first day stepping in the hole, there isn't any way that she would have been able to be participating in gymnastics the next day.
Now, what about a combination of the two? Hurting the bone perhaps slightly one day and then even more the next day?
If she had if she had fractured the bone the first day, she wouldn't have been walking on it after the fracture.
How painful is this type of injury?
It's painful.
Would it be known pretty easily to those around a child?
Yes.
How do children normally express pain when they have broken limbs?
They won't use the limb.
Did you conduct a physical examination of Laila?
I did.
And what did you note from the physical examination?
So she was difficult to examine. She didn't cooperate. She was very fussy. It's difficult to get 2-year-olds to cooperate with a physical exam to start with. And when they're hurt, they're even more reluctant. And oftentimes they don't particularly want to be at doctor's offices. So she had pain and swelling around her knee on the affected side, and I didn't notice anything else significant at the time.
Now, would you have looked at the entire body and done a full body exam of Laila?
I would have.
Did you notice anything at that point, any bruising at that point?
I didn't.
Did you examine the arms at that point?
I did.
And did you notice anything unusual about the arms?
I did not.
Now, did you ever discuss your concerns with any other treatment providers?
I did.
And who were those providers that you discussed your concerns with?
The day that she presented to clinic, I called the urgent care, the CHOA urgent care that she had been seen at initially, and referred her to me and discussed the injury and my concern for non-accidental trauma with the attending emergency room physician there.
Okay.
And then subsequently, I wound up discussing the patient with a social worker and a child protective service worker at Eggleston, and also one of the nurse practitioners. I believe she was a mid-level at Children's Healthcare of Atlanta. Or I'm sorry, at the time it was Children's Orthopedics of Atlanta, which is now Children's Healthcare of Atlanta Orthopedics.
Okay. I'll back up a little bit. First, let me ask you this. What was the time frame between when the first injury allegedly happened when she came or first saw treatment? I can put this back up on the screen
It,
for you if that helps you.
it was close to a week.
So what was the date?
The date that they said the injury, they said that, can you pull it down a little bit? Oh, on 10, they said it happened on 10/15, and then I saw the patient on the 20th.
And she had been to Hudson Bridge the day before?
I believe so.
So that was about a 4-day delay?
Yes.
Is there anything regarding the delay that causes you concern?
Yes, it's one of the, when you look at a list of risks associated with non-accidental trauma, one of the big red flags is delay in treatment.
And why is that?
Because if your child has a broken leg or an injury, isn't using the leg, you would expect that you would take them to a provider quickly and not wait to have them see a provider after the injury.
Now, the fracture that we saw on the screen, a complete tibia fracture like that, is this a common fracture to see in children?
A complete tibia fracture in that region and in somebody her age is not common.
Now, you said that you called over to Hudson Bridge, correct?
Yes.
And you discussed your concerns with them. Now, what did you do after you discussed your concerns with the providers over at Hudson Bridge?
The day when the patient was in clinic.
That's correct. The day the patient was in.
So I splinted the patient and I asked them to go to the Eggleston Emergency Department.
And why did you ask them to go to the Eggleston Emergency Department?
So in the community clinic, I don't have the ability to do a non-accidental trauma workup.
And what is a non-accidental trauma workup?
The initial workup is doing trauma labs, which is measuring certain enzymes, liver enzymes, pancreatic enzymes, blood count, and then doing a complete body x-ray where it's called a skeletal survey where you're looking for other fractures.
And did you express this directly to the foster mother?
I don't remember.
Did you tell them they needed to go to Eggleston?
I did.
And is it saying you don't remember exactly what you said?
I don't remember exactly what I said to the family, but I mean, I was explicit that they needed to go to Eggleston that day straight from the clinic.
Did you do anything in your medical records to memorialize your visit?
Yes, I believe so.
Is there a letter that was sent?
There was a letter that was sent to Seth Carson and Karen, who was a primary care provider that I had lots of referrals from in my Stockbridge office.
Okay. And in that letter, did you write anything regarding your concern?
I did.
And I'm showing what's on the screen is stage 182, the medical record. If you could read the history of present illness.
So this is a 2-year-old who, per mother's report, initially injured herself on 10/15, almost a week ago, playing in the backyard at her Nana's house, and she fell into a hole. The next day she was at gymnastics practice. She lifted up her leg for a pike and fell, apparently re-injuring the leg, at which point, according to the mom, she stopped bearing weight on the extremity. They then waited until 10/19, so over the weekend, to take her in for evaluation. She was taken to the children urgent care last night where x-rays showed a proximal tibia fracture. She was placed into a splint and sent here for follow-up.
Did you ever do anything to follow up to see if they had actually gone to children's health care like you instructed?
I did. So I had a very close working relationship with the residents at Emory, which are the initial contacts for orthopedics at Eggleston. I called the resident who was on call and let them know that the patient should be coming. I also called the ER and let them know that they should be coming.
To your knowledge, did Ms. Rosenbaum ever take Laila Daniel to Eggleston?
She did not. So I followed up that night by looking at Epic to see if they had ever showed up at the ER, and they had not.
And what is Epic?
Epic is a electronic medical record that Children's Healthcare of Atlanta uses. It's accessible from anywhere, so you can look, and any visit in there would be documented.
Do you recall if Ms. Rosenbaum ever said anything acknowledging the need to go to Eggleston?
She did. She said she would go.
Did she say when she would go?
She said she would go that afternoon. I asked her to leave immediately and go to the emergency department, and she acknowledged that she would go, that they were on their way.
So later that night when you called, they had not gone?
I checked in Epic and they had not gone, and I called my resident and confirmed that they had not showed up and that they were not waiting to be seen. Sometimes you can be waiting to be seen for a long time out in the waiting room, and they weren't there.
Did you do anything else to follow up?
I did. The next day I called up to Eggleston and called the ED, which put me in contact with one of the social workers who was there then said that they had CPS in-house, and talked to them about the case.
And what is CPS?
Child Protective Services.
So the information you received that Child Protective Services was involved?
So it was at that point that I got a clear understanding that there was already an open defects case on this patient, and that they were following her.
So your understanding was the DFCS was following this child?
Yes.
After that, did that do anything to allay the concerns that you had?
I don't remember, but apparently not, because I still made other phone calls.
Okay, and tell us about that.
So after that, I could see in Epic that the patient was seeing another provider from a different group. And I called that provider and relayed my concerns to them about the patient.
After that point, did you have any further treatment and involvement in the treatment of Laila Daniels?
I did not.
Doctor, I want to show you some other x-rays, okay? I want to show you what's been previously admitted as state exhibit 130. Just for the record, this is the x-ray from Laila Daniel that was taken on November 17th of 2015. What are we looking at here?
So that is a view of part of the humerus, the large bone in the upper arm, and then both the bones in the forearm, and a partial view or a complete view of her wrist and part of her hand.
And you did not actually treat Laila on November 17th, correct?
I did not. I splinted the leg.
Back in October, correct?
Right, and asked them to follow up at Eggleston. No.
But looking at this particular X-ray, just as an expert in this field, what do you see? What do you see when looking at this X-ray?
There's a transverse, non-displaced fracture of her ulna.
So in English, what does that mean?
That means that she has a break in her ulna that isn't moved out of place. The bone is still lined up where it should be. It's in the middle of the bone, and there's also a fair amount of healing around the fracture.
Okay. Let's talk first about the mechanism. Can you tell anything regarding the mechanism of how a break like this occurs?
It's called a nightstick fracture.
Why is it called a nightstick fracture?
It's called a nightstick fracture from back when law enforcement used to carry nightsticks. And it's the natural response of somebody being attacked to put their arm up like this. And if you put your arm up like that and get hit by a nightstick, you could get a fracture of the ulna. So it actually has a pseudonym that goes along with what was that common from the mechanism.
What other types of things could cause this type of fracture?
Getting hit, a blunt force trauma to the side of the arm that the ulna's on. That's about the only thing that can cause that fracture.
Now, you mentioned there's some healing here. How can you tell that there's healing here?
So all of that fluffy, cotton ball looking.
If you need to, you can get up and with the pointer, and we have the old school pointer too, that's better.
All of this is called callus. So all this, and that's called bridging callus. When the callus goes across the fracture site, it's called bridging callus, and that's the way fractures that are treated by cast immobilization or no immobilization heal. So at first there just would have been a line that goes across right here if you had seen her early on in this fracture. Within about 10 days, this callus would start to form. And the callus forms almost like an onion skin, or an onion, in that it forms layers, and as that callus gets thicker and thicker and thicker, it keeps the bone from wiggling. And once the bone stops wiggling enough, the cells that take bone away and form bone come in and reunite the fracture. So it's basically the body splinting the fracture so that those cells can then come in and do their job and heal the bone up.
And is this the type of healing that would occur, you said, if the arm had not been splinted?
Yes. Okay. Even it's the kind of healing that would have occurred if the arm had been splinted. There's two mechanisms that bone can heal by, main mechanisms, either primary healing or secondary healing. This is called secondary healing. Primary healing is if you do a surgery and you put a plate and screws to hold the fracture in place. The fracture can't wiggle then, and you don't get a bunch of callus formation like this. In children, it's very rare to put plates and screws in or any sort of orthopedic implant because they heal so well, especially at 2 years old, that you can put the bone almost anywhere, leave it where it is, and they grow so much that the bone heals back together. And then as they grow a little bit more, it remodels. Excuse me. excuse me, so that eventually the fracture disappears.
Okay. So I guess this goes back to the kids. Kids sometimes heal a little bit differently than adults.
Yes.
Okay. And so you said that at a certain point you wouldn't even be able to see the fracture line anymore.
If you had let this go and taken the x-ray again in 6 months, you never would have known the fracture was there.
Let's talk about, we talked about the callus begins to appear at about 10 days. What about this being on the other side? How old could this be?
By looking at the fracture, I would say that it's no more than 3 to 4 weeks old at the most.
Are you familiar with the term non-union fracture?
I am.
And what is a non-union fracture?
A non-union is when the two ends of the bone do not heal back together.
And is that what we are looking at here?
No, that's normal healing in a pediatric fracture.
Is there any evidence whatsoever from looking at that photograph or from that x-ray that there is any sort of non-union appearing here?
No, that's perfectly normal looking for a neck fracture.
Now, how likely is it for a 2-year-old to have a non-union fracture?
It's almost unheard of.
When would you see a non-union fracture?
Non-unions usually happen in adults, and usually adults that have comorbidities, such as diabetes, have other things going on, that have diabetes, or they have some sort of vascular problem, or they've had a bad infection. Children, I've never seen a non-union in one of my patients.
Well, I'm looking into evidence states 183 through 186, which is self-authenticating medical records from Millie Place from Piedmont Henry Hospital. The business record certification is attached.
Amen.
Doctor, I also want to show you states 184. What are we looking at in states 184?
That's an x-ray of a pediatric patient's elbow. It would technically be called an oblique view because it's looking at an angle, which shows a healing fracture at the end of the humerus right there.
How can you tell that that's a healing fracture from what you're pointing at?
This is called periosteal reaction. Everybody's bone is surrounded by a tissue called periosteum. In children, the periosteum is very thick and robust because their bone is growing so much and changing so much. As we get older, it gets very thin. But in somebody this patient's age, the periosteum will be very thick. And when you have a fracture, you get, even if you can't see the fracture initially on an x-ray, which would be called an occult fracture, which happens a lot around elbows. If you come back and take an x-ray at 2 or 3 weeks, you'll see this periosteal reaction forming, tracking up, and then as the fracture heals, that will go away within 3 or 4 months.
This one also showed states 185 and 186. Is there anything different that we can see in this particular x-ray?
There's still periosteal reaction there. There appears to be a fracture over on the lateral condyle of the bone over here. This is the lateral condyle. So look, there's a lucency through there, but you can still see this periosteal reaction coming up.
In stage 186.
There's really no visible fracture healing on this. There might be a very, very, very mild periosteal reaction right there.
And so from what you can see, how old would this injury have been from what you can see on x-ray? And I can move it back to the first.
Yeah.
I can move back to 184.
This would probably be about between 2 to 3 weeks old.
I want to go back to stage 130 very quickly, just regarding the timing again. And this is looking at Laila's ulna from that was taken on November 17th of 2015. Yeah, you said that you start to see the callus at about how long?
So part of it depends on patient age. In very young patients, you see it very, very, very quickly. As patients get to be teenagers, you don't see it as quickly. They start to heal more like an adult. And somebody 2 years of age, you'll start to see the healing in callus usually around 10 days.
And then you also said that it could be this could also be up to about 3 to 4 weeks, correct?
Yeah, that probably looks like it's about, I would say, median of 3.
median of 3.
Right.
Okay. So from looking at that, the fracture probably occurred within that time period of 10 days up to about 3 weeks.
Yes.
Thank you, doctor.
Thank you, Plus.
Dr. Duxbury, good morning.
Good morning.
My name is Kareem Mall. I just have a few questions for you.
Yes, ma'am.
If you can't understand what I'm saying, I'm not speaking loud enough, please let me know. Dr. Duxbury, you saw her on the 20th,
Yes,
correct?
yes, ma'am.
And you saw her for the purpose of putting a cast on her, correct?
I saw her for the purpose of treating the fracture, which doesn't necessarily intending, especially in an early fracture, it doesn't involve putting a cast on immediately.
But you did not treat it, did you?
Define treat. I saw the patient and I put her into a splint, which would be the initial treatment for that fracture.
Didn't she come to you in a splint?
She did, but you have to take the splint off to examine the extremity.
So you put the splint back on.
Yes, ma'am.
And then you told her to go to Eggleston.
Yes,
to Showa.
ma'am.
She had just come from Showa Urgent Care, and you were sending her back to Showa Eggleston, correct?
Yes.
Now, I just want to talk a little bit about your medical records that we had looked at. This letter to Dr. Sankaran just says that you are concerned about the history of this child, correct?
No, ma'am. It says I'm concerned for non-accidental trauma in this case.
Okay, and where do you say that?
Can you put the record up? So go down to the bottom. Keep going down. There should be another page. So it says, I'm a little concerned about the history of this child and the amount of time it took for the urgent care to be worked up, so I'm having her go to Eggleston where she can be evaluated by social work. Meaning that I'm concerned about the history of this fracture, why it took so long for the patient to receive care for it, why the story changed and didn't seem to be inconsistent. There was a lot of red flags with this patient for non-accidental trauma.
Did you say non-accidental trauma anywhere in the letter?
No.
In fact, Dr. Duxbury, when you talk about inconsistencies, what inconsistencies are you talking about?
So major red flags for non-accidental trauma, delay in care, changing story.
How did the story change?
So initially, the time frame kept changing while I talked to her. The mechanism where you're saying, well, first she injured herself by falling into a hole, and then the next day she injured herself at practice, that's not consistent with something that would happen.
Okay. But her story did not change. She came to you and said that the child had fallen into a hole, and she told you the child had then had a second occurrence and fell into as a result of gymnastics.
Okay, fair enough.
And it's true also that she told you she was the foster mother.
She said that she was the foster mother. She never mentioned that the patient was in DFCS care.
But she never told, well, by definition, if she's in foster mother, she's in DFCS care.
I don't know whether that's true or not.
Okay, well, isn't it true that she did not say anything to you about being adopted, the child being adopted?
It says on the intake form that she's adopted. She wrote that.
She did not write adopted. She did write foster mother, didn't she?
She wrote adopted right there underneath reason, adopted, history of abuse.
Are you trying to say that Piedmont Henry is written by the same person as wrote adopted?
Yes.
So she would have written, you were telling this journey, she would have written foster mother on the right-hand side and adopted on the left-hand side.
Everything on the left-hand side of the form was filled out by the guardian.
You don't know that to be the case. That's what it was planned. But in fact, somebody else wrote adopted on there, not the same person that wrote Piedmont Henry. And all of these were, this is not the same handwriting.
Okay. I can't confirm that.
She checked no to the question, was there a family history of this? or a similar problem?
I'm sorry, she checked.
She checked no to that, didn't she? About whether there was a family history of this?
Family history of fracture?
Yes.
She did check no to that.
And she also checked no to any past medical history, didn't she?
Correct.
But somebody wrote in history of abuse under adopted, correct? HX is history.
It says history of abuse.
Now, is it not true, doctor, that you and Ms. Rosenbaum had a discussion about whether or not, about your price list? Isn't that correct?
About my price list?
Yes.
No, that isn't something I would discuss.
And you did not discuss what you would cover by Medicaid and what you wouldn't?
I can't discuss that, and I don't know what Medicaid covers. I don't have anything to do with billing. All I do, I see the patients, I provide the treatment plan, but as far as the billing side of it goes, I have nothing to do with that.
Someone in your office has something to do with that, correct?
Yes, ma'am.
Isn't it true that Ms. Rosenbaum went directly to another doctor?
No, that's not true.
Why
It's
is
my
that?
understanding she went several days later to another doctor.
How many days later?
I believe 2 or 3.
2 or 3 days later from when you saw her,
Yes, ma'am.
to Dr. Coppinger?
I'm not sure who Dr. Coppinger is.
But you're saying that 2 or 3 days after she saw you, she went to see another doctor.
I believe she went to go see a mid-level provider.
And you say that was 2 to 3 days.
I believe so. I'm not sure on the exact timeline after that. I know that she didn't go to Eggleston that day, and that it took several days after that for her to be seen by somebody else.
Where in your medical records, doctor, is the referral sheet for Eggleston?
There is no referral to Eggleston.
So there's no mention here of no sheet given to her saying to go to Eggleston, just your verbal,
You wouldn't do a referral sheet to Eggleston.
you would just tell her to go to Eggleston.
Yes. Referral sheets are required when they're seeing another provider that insurance would require a referral for. There is no referral required to go to emergency department.
But usually when somebody tells somebody to go to another establishment, you provide them with documentation that they should do so.
No, ma'am.
Okay.
We would have provided her with the address of Eggleston, and we would have alerted them to let them know that she was coming.
And where is that reflected in your notes?
It's not.
That's all I have.
Thank you.
Doctor, is the letter that we saw that's in the medical records part of the medical record?
Yeah, I'm sorry, yes.
That letter's part of the medical
It
record?
is.
Right. And what's the date on that document?
10/20/2015.
And in that document, do you actually mention the need for her to go to?
Yes.
This is not something you're making up today, correct? No. And why would you send someone to Eggleston versus back to, say, Hudson Bridge?
So, although they both are called Children's Healthcare of Atlanta, they're very different entities. Hudson Bridge is an urgent care. It's a portal. It's somewhere to see minor injuries and treatment. Eggleston is the only level 1 pediatric trauma center in the state of Georgia. So if you're concerned, they are a tertiary care facility where all of the needed resources are in one place to do a proper workup. You have emergency medicine doctors, pediatricians, orthopedists, access to imaging, access to labs at that time, social work and child protective services, all underneath the same roof.
Are you familiar with the Stephanie B. Blank Center for Safe and Healthy Children?
I'm sorry?
Are you familiar with the Stephanie B. Blank Center for Safe and Healthy Children, the child protection team?
At Eggleston?
Yes.
I've dealt with them, yes.
And are they also contained at the Eggleston campus?
There is, to my understanding, in-house child protective services.
The fact that there was a further delay between your visit and when she went to go see Mr. Coppinger, does that cause you any more concern?
Yes.
And why is that?
So another red flag for non-accidental trauma is provider shopping.
What do you mean by that term?
Seeing multiple providers.
And why is that concerning?
Well, you have to question why, if it's a straightforward injury, why are they, it's not like they're going for a second opinion. They're seeing multiple providers for the same problem.
Did Ms. Rosenbaum seem confused at all when you told her she needed to go to Eggleston?
No.
Did it appear to you that she didn't understand your directions when you told her to go to Eggleston?
No, she acknowledged that she needed to go to Eggleston.
Nothing further.
Anything in Dr. Sankaran, letter to Dr. Sankaran that reflects you gave a copy of that letter to Jennifer Rosenbaum?
I'm sorry, I don't understand the question.
Anything in the letter to Dr. Sankaran that reflects that you gave a copy of that letter to Jennifer
In
Rosenbaum?
order for her to get a copy of a medical record, she would have to request it through the medical records department. That's the law.
But you did not give her a copy of the letter.
I don't know if she asked for a copy of the letter.
In fact, isn't it true that sometimes people don't have the best of bedside manners? Isn't that correct?
Yes, that is correct.
And isn't it true that people go to other places?
That's true.
And isn't it true that sometimes one doctor doesn't cover certain procedures or include certain treatment in their Medicare coverage?
There was no treatment that wasn't covered. I took as far as I know, every insurance that is available in the state of Georgia, including Medicare and Medicaid, whereas I believe the provider she went to afterwards does not see Medicaid and Medicare patients.
But you don't know that, do you?
Excuse me?
You don't know that to be the
As
case.
far as I know, Children's Orthopedics of Atlanta did not take Medicare, that the only two Medicare or Medicaid providers in the state for pediatric orthopedics were Emory and Pediatric Orthopedic Associates.
So you don't know much about billing in your office, but you do know about the billing in somebody else's office.
I know what insurance they took.
Isn't it true, doctor, that 2 to 3 days is sometimes the time it takes to get an appointment?
For an urgent care, probably not.
But for an orthopedist?
No, we would regularly see people the next day.
But other providers might have full appointment schedules, correct?
They might,
And they might take 2 or 3 days to get in to see.
perhaps.
Thank you.
All right, thank you, doctor. You can step down. And any objections to this being excused?
Not in the state.
If I may confirm. I would like the opportunity to recall him, Your Honor.
Judge, he's here from Texas and he's flying back. I don't, the defense is free to fly back if they wish, but his flight is to go back to Texas.
He's excused.
Your Honor, may I ask him one last question before we leave?
Let's see if he's still out there. Dr. Slaughter.
Doctor, I'm going to show you what I've marked as Defendant's Exhibit 121. If you would tell me what that is.
It's a billing sheet,
And where is that billing sheet from?
Pediatric Orthopedic Associates.
Is that where you were working when you treated Laila?
Yes,
And is that reflect what Medicaid will cover and what your office will not accept?
I don't know.
Take a look at it and see if that refreshes your recollection.
So I don't know what Medicaid would cover, and I don't know what my office would accept.
Okay. But this is your office's sheet, isn't it?
Yes,
Okay. And this is what your office, what is covered by insurance or not covered, correct?
I don't know.
Your Honor, at this time, I would tender Defendant's Exhibit 121.
Considering it's already part of state 182, we have no objection.
All right.
We would ask the defendant the evidence if we may display it, Your Honor.
Okay, it's admitted to separate exhibit and made select.
What does that document say, Doctor, with regards to your office policy?
You want me to read it?
Yes.
The following supplies are not covered by the above insurance companies. When distributed through this office, you can purchase any of these items listed below from our office, for which payment is due upfront, or the physician can write a prescription, and we will gladly give you a list of supplies who can bill these insurance directly for purchase.
And is Medicaid one of the recipients of the insurances above?
Yes, it says Medicaid, Peach Care, Amerigroup, Peach State, and WellCare, which are all Medicaid.
Thank you, Doctor. I have nothing further.
Anything else? Just very briefly, doctor, just very briefly.
I'm sorry.
No, you're fine. Did you even have any, do you recall any conversation with Ms. Rosenbaum whatsoever about any concerns paying for any of these?
No, and I'm not sure where this questioning is getting at, because there's nothing on that list that would have been needed to treat her fracture.
Nothing further.
Anything else?
Okay. And you're excused. Thank you. Okay, this is time for us to take our morning break, so we'll take 15 minutes and then we'll come back. Thank you. Just turn towards the face, let's for you.
If you can raise your right hand to be sworn. Do you swear or affirm that the testimony you shall give in this matter will be the truth, the whole truth, and nothing but the truth, so help you God? You can put your hand down, take a seat. Can you state your name for the record?
Charles Coppinger.
Mr. Coppinger, how are you currently employed?
I'm employed as a physician assistant at Children's Healthcare of Atlanta Orthopedics.
Okay. And what do you do as a physician assistant at Children's Healthcare of Atlanta?
I diagnose and treat patients under supervision of a physician, not direct supervision. They review our charts. I mostly see acute injuries.
Okay. And what do you mean by acute injuries?
Fractures, sprains, strains, any kind of trauma kind of stuff.
So you said that you are currently with Children's Healthcare of Atlanta. How long have you been with? How long have you officially been under the Children's Healthcare of Atlanta umbrella?
Oh, since I was previously with Children's Orthopedics of Atlanta, and they bought out our practice in December of last year.
So in October of 2015, who technically was your employer at that point?
Children's Orthopedics of Atlanta.
Were you officially under the Children's Healthcare of Atlanta umbrella at that point?
No, sir.
And your background, have you primarily worked in the orthopedics field?
Yes. For basically for 17 to 18 years, I've been in orthopedics, and 15 to 16 of that exclusively with pediatrics.
Okay. Did you ever have an occasion to treat Laila Daniel?
Yes, sir.
And do you recall the date that you first treated Laila Daniel?
That was on October 23rd of 2015.
Your Honor, at this time I move into Evidence States Exhibit 187, which is the medical records from Children's Orthopedics of Atlanta. It does have an attached affidavit of certification of records. So if you ever need to look at the records, because it's not a memory test, so if you need to look at these, just let us know, okay? You said that she came in on October 23rd, 2019, correct?
Yes.
What was your knowledge at the time of any prior visits that she may have had with other providers?
The only visit that I was aware of at the time was a visit with the Children's Healthcare Urgent Care at Hudson Ridge.
Were you aware of a visit with Dr. Duxbury?
No, sir.
What was the purpose of Laila visiting you that day?
She had a leg injury on her right leg, which turned out to be a fracture.
And do you recall how she came into your office that particular day? As far as, did she have any medical devices on her body at that time?
Oh, yes. She came in. She had been seen at the urgent care, and they had placed her in a splint, which is sort of almost like half of a cast, which is it's a fiberglass that goes down the back of the leg and then it's wrapped on with like an ace bandage.
Okay. Now, do you recall who she was brought in by?
It was her mother, according to my notes. I can't recall. Like I said, if it was foster mother. That part is not in my notes whether it was foster or not. So.
Okay. She was brought in by someone identifying as her mother.
Yes.
All right. And did you get a history from this person regarding how Laila hurt her leg?
Yes.
And what was the history that you received?
The history was that she was at a gymnastics facility, and a sibling had a class there. She wasn't there for a class, and she went out, was playing, and climbed on a balance beam, and had fell off the balance beam.
Was there anything mentioned about being on bars?
No, sir.
Was there anything mentioned about doing a pike?
No.
Did she indicate what happened on the balance beam?
Just that she climbed on it and that she fell off of it.
Did she provide you with the date of this injury?
Yes, it was October 18th of 2015.
And that would have been the day before she went to the urgent care center. Is that correct?
Yes.
Did at any point she mention anything about falling in the grandmother's yard?
No, sir.
Did you see the X-rays?
Yes, sir.
All right. And was there a fracture there?
Yes, there was a fracture in her proximal tibia, which is the upper end of the bone in the lower leg.
Okay. At that time, based upon the history that you had, did you have any concerns at that particular time?
No, I did not.
Okay. What did you do as a result of having this particular fracture?
We at the time we placed her in a cast, which comes up above her knee to about mid-thigh and down to her foot.
Now, do you do an examination?
Yes, sir.
What do you examine?
And so typically, with my practice being acute injuries, our exam is pretty focused. And so typically it's mainly just the affected extremity. We do sometimes compare to the opposite extremity. Also, we usually don't do a full body physical exam though. So
Okay, so just I didn't do so well in science. Okay, if you're doing just the one, when you're talking about the extremities, if someone comes in complaining of the leg, you may look at the other leg. Is
Yes.
that correct? But you may not necessarily look at the arms.
exactly.
All right. Now tell me about how, I guess, the clothing, if someone were to have this type of fracture, what kind of clothing can you treat them in?
Typically, if it's a lower extremity or leg fracture, if they come in shorts, then a lot of times we can just leave them in the shorts that they're in. If it's in one of the cooler months and they're in pants, then we provide them with we have some paper type shorts that we put them in.
Did you have, from the examination, did you note any bruising that wasn't associated with the fracture?
Not anything out of the ordinary.
Did you note any bruising that was associated with the fracture?
Yes, there was some mild bruising around the fracture site.
Is that typical for this type of fracture?
Yes, that's very typical. And typically the bruising is more when they have a fracture, the bone bleeds underneath the skin, and that will come to the surface. And so typically you'll see that within 3 or 4 days after they have a fracture.
Okay. Now you mentioned that you were not aware of her going to another orthopedic doctor, correct?
That is correct.
If you had known that, would that have caused any concern for you?
Yes, definitely so, as to why they were coming to a second provider.
Sorry, I couldn't hear you.
Yes, that would concern me as to why they were not treated by that provider and are coming to a second provider. So there would have been definitely more questions asked at that point.
If they were referred to Children's Healthcare of Atlanta, would that have concerned to go to the Eggleston campus? Would that have concerned you as well?
Yes.
And why is that?
Because typically, if anytime that I myself send someone, refer them to the Eggleston campus or our Scottish Rite campus, which is the main 2 hospitals that we refer to, it's typically for either some type of surgical intervention or there's a suspicion of non-accidental trauma.
Now, what did you do? I think you said that you did some casting on the leg, correct? Can you describe to us where you put the cast on the leg?
Okay, so the cast basically runs from her mid-thigh down and out to the toes.
Showing you stage 157. Is that the? I don't think we need them off. Is that the cast? Is that the cast that you put on Laila?
Yes, sir.
How high up on the thigh? I can't quite see it quite well on that one. How high up on the thigh does it go?
Yeah.
If you can stand for us.
Mid-thigh, maybe 3/4 of the way up the thigh. There's a little bit of leeway.
If you can stand for us and just kind of indicate on yourself.
So typically it will go anywhere from mid-thigh to here. You know, just enough to give you enough room where it doesn't rub there.
Okay.
Too high.
Now, is there ever any bruising or chafing that people might get from having a cast on?
There could be some maybe a little mild chafing, not bruising though, not typically.
Now, is that the only time that you saw Laila Daniel?
No, sir.
And when was the second time that you saw her?
The second time was a week later, which was on 10/30.
And what was the purpose of that exam?
That was a follow-up visit for the fracture. Typically, with a fracture, if it is what we term a complete fracture, which means it goes all the way through the bone, those have potential to shift around even in a cast. And so we see them back in a week to make sure that they're staying lined up and not shifting and make sure they're healing properly.
How long is this? Exam normally? How long does it normally take?
That visit is usually very quick. Basically, we take a quick look at the cast, make sure everything looks like it's fitting well, and we shoot a quick X-ray, and that's basically the extent of the second visit.
Do you do any sort of examination on the rest of her body?
No, sir.
Was that the last time that you saw Laila Daniel?
No.
All right. When was the last time you saw
her? To get her cast off, and that was on November 13th of 2015.
And you said that was the to get her cast off?
Yes, sir.
How extensive of an exam or visit would this type of visit be?
It's somewhere between the other two. Basically, you do an exam of that extremity. Typically, I'll kind of compare it with the other extremity and show the parents, because typically when they've been in a cast like that, they'll have some muscle atrophy from not using that leg, and so usually I'll kind of compare and show this to show the parents, hey, look, this leg's going to be weaker, and they'll have a little bit of a limp for a little while afterwards.
Okay. Do you recall who brought her in?
Her mother again at that time, and I believe there was a gentleman with her too at that time. I'm not sure if it was father. I'm not sure. Okay, to be honest.
So the clothing. Do you recall the clothing that she was in?
She had on and I think the first visit it was the one that I recall that she had on it was sort of a Halloween themed outfit. It had kind of some flared little legs at the bottom of it. I don't remember exactly what it was, but it had flared legs.
I'll show you this fence exhibit 10. Is this what you observed her wearing or not?
Yes.
And was that
That was it.
that was on the last day?
That was. I can't remember if it was the first one or the last one, but I remember the outfit. Like, to be honest, I can't 100% say.
Judge, I would just note for the record that the stipulated date is November 14th of 2015. And that was the same day that she came in to see you, correct?
The 13th.
Oh, I'm sorry,
Yes,
the 13th.
13th.
My bad.
Yes.
Tell me about the, did you notice anything at that exam that seemed out of the ordinary to you?
No, sir.
And again, what parts of the body did you examine or look at on this type of visit?
Mainly the affected leg. The other leg, like I said, for comparison purposes. But you know, and if the rest of the body, we don't really examine at that point. So.
Okay. And did you notice anything when you took off the cast that seemed unusual?
Nothing out of the ordinary.
Okay. I want to show you what's been previously admitted as State's Exhibit 54. This particular, do you recognize the area of the body that this would be?
That is looks like the inner thigh.
Okay. And is that the same leg that the cast was on?
It appears to be, yes.
Now, was there any indication that the cast caused that injury?
No.
Would the cast have even gone up that high?
No, the cast was, first of all, the cast wasn't up that high, and second of all, I would have noted that too. If I saw that, because that would be unusual to see that.
I'm going to show you the State's Exhibit 56, which is the flip side, looking at that same injury. Again, is there any indication that the cast caused that injury?
No, sir.
Did you see anything even remotely appearing like that when you took the cast off?
No.
Would the cast have even been that high?
It should not have been, no.
And I'll show you what's been admitted as State's Exhibit 57. Did you see any of those bruises on Laila when she visited you on the 13th?
Not that I recall. So, not that I recall seeing any bruises there.
Okay. And was that the last time that you examined Laila Daniel?
Yes, sir.
Okay. Nothing further at this time.
Thank you, Ross.
Mr. Coppinger, Dr. Coppinger?
I'm a physician assistant.
Physician
Mr.
assistant.
Coppinger.
Mr. Coppinger, my name is Corrine Mull. I'm going to ask you a number of questions. I just ask that you let me know if you don't understand my question or if I'm not speaking loud enough, if you'd let me know. Mr. Coppinger, you saw Laila on the first time you saw her was on which date?
On October 23rd.
On October 23rd.
Yes.
And you had been told that symptoms had begun on what date?
On October 18th.
Were they given you a date, or were they just told you several days before?
They would have given me a date.
Okay.
You know, that's one thing. If you talk to my staff at the office, that's one thing I'm very particular about. Is I want a date of injury on there, because sometimes when they're bringing patients back and doing that and putting the stuff in, some people tend to want to put last Tuesday or something like that. And I'm very particular. I talk to them all the time. I want the date. I want the date on the chart of the date of injury.
And you noted that she was well nourished and in no distress, correct?
Yes, correct.
And how did she come to you? Did she walk, or was she carried in?
At that point, she was carried.
She was carried in. And you said that she had full range of motion, correct? Full ROM.
Yes.
You noted that she had no tenderness.
No, on the. I would have noted that she had tenderness. Yes, she did have tenderness.
She
On the
did
right.
have tenderness, or she had no
Yeah,
tenderness?
no, she had tenderness on the right lower extremity. The left lower extremity, my note says that had no tenderness, but the right lower extremity did have tenderness.
And lesions, abrasions, bruises, or lacerations, what did you say?
Nothing that was out of the ordinary. With kids, the majority of kids that come in will have a bruise here or there. That's not uncommon, but nothing was noted that was out of the ordinary.
Is this type of bruising what you would call out of the ordinary?
That could be considered ordinary, depending on the kid.
And you wrote down that what the x-rays showed you was a minimally impacted proximal tibia fracture.
Yes.
Correct? What does minimally impacted mean?
Means basically when we say impacted, kind of crushed down just a little bit.
Okay. So wouldn't require a great deal of force.
Sort of a medium amount of force, I would say.
Okay.
So
Sufficient force that a 2-year-old could exert when falling.
if they fell from a little bit of a height, yes. The most common way we see these is trampolines, which have force coming up, and that's in this age group. That's the most common thing we see is from a trampoline. The force of the trampoline. Usually, there's an older kid and a younger kid, and the trampoline's coming up, and the kid is coming down. And that's the most common, by far, the most common way we see these. Probably 90% of them are.
So, but gymnastics did not seem to be out of the ordinary. To
No,
you.
if she was on a balance beam and fell off, that seemed plausible.
Where in your notes did you say that there was a balance beam?
So with my notes, I did state specifically that there was a balance beam. And in my notes, it said that there was that it was a sports injury, and that's basically from memory that it was a balance beam.
But could you be mistaken? Could it have been some other type of fall from gymnastics?
I specifically remember Mom saying she climbed on the balance beam and fell off. And that she wasn't taking a class, that it was a sibling that was taking a class, and she was just there, and she went over and climbed up on the beam and fell off.
And when you saw her, she was in a diaper and a pull-up, right?
I believe that she probably had a pull-up on. I can't say 100% certain.
And you didn't see any cuts or lacerations or
No.
bruising
No.
anywhere?
No, not anything out of the ordinary.
And you didn't see any evidence that she was favoring her arm or holding her arm as if it hurt?
No, ma'am.
You didn't notice anything having to do with her arm as being painful or tender?
No, with my exam, I didn't notice her not using it or any kind of deformity or anything like that. I didn't do a specific exam on the arm, but I didn't notice anything out of the ordinary with the arm at the time.
And she didn't hold it up to you and say it hurts or anything?
No, ma'am.
Okay. You said she appeared well-nourished and without distress, correct?
Yes, that is correct.
Now, what did you put her in when you say you put her in a cast?
It's basically a cast is it's made of fiberglass. It's wrapped on there. Underneath there is cotton padding underneath there, and initially you put on a cotton, what we call a stockinette, which is kind of like a long sock that goes underneath there, and then you wrap cotton padding, and then you wrap the fiberglass as it's wet, and then as it dries, it hardens.
And did you put her in a boot?
She would have been given a what we term a cast shoe, which is just a little thing that straps over the bottom of the cast so she can put weight on it.
And tell me if you would, did you give her any type, is it typical with children that sometimes you give them a piece of the stockinette or a piece of the cotton?
Yes, sometimes we do. Yeah, sometimes they'll be in there and they'll kind of play with it, and we'll let them have that. Yes.
And do you recall doing that for Laila?
I don't recall specifically. No.
But it would not surprise you?
No, it would not.
Do you recall putting, well, let me ask you this. Why did you put a full cast? Would it have been appropriate to have left her in a splint?
Not typically. The reason being is the splints don't support the fracture as well. With the splint, they're not able to get up and weight bear on that splint, and it's really hard to keep a young child off of it to start with, so they need the extra protection of a cast. And also a splint can loosen more over time and can cause some problems, especially with the heel area of getting pressure sores with younger kids.
So leaving her for a week in a cast or a day leaving her for a day or a week in a splint would not have been proper medical treatment, would it?
No, for short term, it is. For long term, it's not. For short term, the reason that they initially splint them as opposed to casting them is, well, there's a couple of reasons. One is so when they come to see us, we can get a good exam of our own. And then number two is for the first 2 or 3 days, the fractures tend to swell. Okay, if you put a cast on immediately, the cast can get too tight. Whereas a splint, because the front of it is just an ace bandage that gives, and so that's the reason we use the splint. Usually, typically, depending on the fracture, anywhere from 1 day to some fractures, we leave them in a splint for as much as a week or more. Okay, if it's a really bad fracture that we're really concerned with the swelling.
That was not the case in this situation, was it?
No.
And did you give her a cast shoe?
Yes, we would have given her a cast shoe.
Did you give her a walker boot or a cam walker?
No, ma'am.
Did you do fiberglass casting?
Yes, ma'am.
Let me show you what's been marked as States Exhibit 182. Tell me, if you would, which of those did you do for Laila Daniel?
So, we would have done fiberglass casting. This is not anything from my office, though.
I understand. I'm just asking you to look at the list.
Fiberglass casting, and then I'm trying to see if there's I don't see a cast shoe on there. I just see the walker boot, so I don't see a cast shoe on there. But typically, I think, yes, so cast shoe, yes.
Anything else on this list that you put on her?
No, that would be all.
Thank you.
So.
Let me show you what I have marked as Defendant's Exhibit 122. And asked you if this is the cast that you put on Laila.
Yes, ma'am. That is the cast, and that is our appears to be one of our cast shoes, also.
So she was meant to walk on it.
Yes, ma'am.
In fact, the more the better.
Typically, the weight bearing, the act of weight bearing, will stimulate it to heal a little faster.
So the more she walks on it, the better it is for her. At this time, Your Honor, is that a yes?
Yes, ma'am.
At this time, I would tender number 122 into the record, Your Honor, and ask to publish. If you would show us the fiberglass casting.
The pink is the fiberglass, and then the black is the stockinette that goes underneath it, and then between those two there is cotton.
And what's on her wrist?
That's,
Is that not a piece of the stockinette?
yes, it appears to be a piece of stockinette.
Thank you. I have nothing further.
Let me ask you this: can different providers use different materials?
Yes, to an extent.
Okay. And you mentioned you don't know what that's not from your office, correct?
Yes.
All right. Let me ask you this. Ms. Mole asked you whether or not it is appropriate to leave a child in a splint for several days, correct?
Yes.
All right. Well, would it have been appropriate to leave a child in a splint and send them to Children's Healthcare of Atlanta for further evaluation and treatment?
Yes, sir.
Would it have been appropriate for the person who is caring for them to ignore that medical advice?
No, that would not be appropriate.
Did Ms. Rosenbaum ever mention to you anything about, during these follow-up visits, anything about Laila having any issues falling in the cast?
Not that I recall. Obviously, any kid is going to be with the cast on is going to be a little more unsteady, but there was nothing that I recall.
Okay, nothing that stands out to you. Okay, nothing further. Good.
So it would not be unexpected that she might trip or give way.
Yes, that could be very possible.
And at your office, when you send somebody to Eggleston, do you give them a sheet of paper that says that you should go to Eggleston? This is the address, this is who you should ask for?
Typically, yes.
Thank you. I have nothing further.
No, further.
Okay, thank you. You can step down. Any objections to this witness being excused? And you're excused from this. State calls next witness.
State calls Carmen Scott.
Carmen Scott.
Have you raised right hand? Do you solemnly swear or affirm the testimony you shall give this court shall be the truth, the whole truth, and nothing but the truth to help you God?
Yes.
And if you could state and spell your name for the record, you can have a seat.
My name is Carmen Scott, Karmenscott.
And Ms. Scott, how are you currently employed?
I work for the Henry County Health Department.
What do you do for the Henry County Health Department?
I provide Children's First services for participants that are referred to the program.
What is Children's First?
Children's First is a referral and resource program. We do family assessments and developmental screenings, and we refer the families to other services that they may need, like WIC services or Babies Can't Wait services, DFCS, pediatricians. We give them phone numbers and contact information.
Are certain families required to have a child's first assessor?
The program is designed to be free and voluntary. However, DFCS strongly encourages their children that are in the foster system to be assessed.
And how long have you been in the position you're in now?
Since 2015,
When in 2015 did you start?
September.
Now, on October 28th of 2015, did you see Millie Place and Laila Daniel?
Yes, I did.
And how come you saw them on October 28th?
Excuse me?
How come you saw the children?
Oh, they were referred through the DFCS system to be assessed for developmental screening.
Who brought them?
Jennifer Rosenbaum.
When you do a screening, do you do a full body exam?
No. The screenings are mostly socio-economical screenings. It's developmental. The parent or guardian fills out the paperwork ahead of time, and I just review it with them. It's all paper. We don't do any physical assessment at all.
And is the paperwork they fill out, what is it called?
Ages and Stages questionnaire. It's called ASQ. I use the ASQ3 version, and it's a standard screening. Pediatricians also use the same screenings when they do well checks.
And is the screening different depending on, or is the questionnaire different depending on the child's age?
Yes, it goes by age. It's 2 months, 4 months, 6 months, so forth, up until 5 years old, or 60 months.
Now, with Millie's assessment, did you use the questionnaire with her?
Yes.
And did you use the 48-month-old questionnaire?
Yes, if that was her age. It is according to age, so depending on her age at the time.
And you indicated that the paperwork is filled out by the child's guardian?
Correct.
So in Millie's case, that would have been Jennifer Rosenbaum?
Yes.
And how did Jennifer answer the question, has your child had any medical problems in the last several months?
I'm not sure right this minute. I'd have to look at the form.
But looking at the questionnaire assist you in answering that question? If you looked at Millie's questionnaire, would that help you answer the
Yes,
question?
if I looked at the yes, because I don't remember word for word. Oh, okay. Yes, so it says no. That is true.
And how did Jennifer answer the question, do you have any concerns about your child's behavior?
She answered no.
And how did Jennifer answer the question, does anything about your child worry you?
She noted that, yes, she had a concern that she has a semi-attachment issue. Semi-attachment issues is how it's written.
On Millie's questionnaire, was there any concern noted about lying?
Not according to this page.
In Millie's questionnaire, was there any notation about a history of abuse regarding Millie?
Not on this questionnaire.
How did Millie act during the appointment?
Well-behaved, quiet.
Is it your practice to take a photo of the child when they come in for an appointment?
Yes, the clerks do that at the front desk when they're first being processed. They check their income, Medicaid, and they take a picture for their medical record. It's just a headshot through glass.
Through glass, you said?
Through glass, yeah, through glass.
May I approach the witness, Your Honor?
May.
Let me show you what I've marked as State's Exhibit 188 and see if you recognize it.
Oh, yes, I do.
And how do you recognize it?
Well, that's Millie, because she had that purple bow.
And is that how Millie appeared to you when you saw her in October of 2015?
Yes.
Tell my tender State's Exhibit 188 and evidence and ask for permission to publish.
Admitted to be published.
This is how Millie appeared at her appointment. Ms. Scott?
Yeah.
Now I want to turn your attention to Laila's questionnaire. Would looking at her questionnaire help you in answering some of the questions?
Yes, please.
On Laila's questionnaire, how did Jennifer answer the question, has your child had any medical problems in the last several months?
She answered that she had a fractured tibia shin bone from a fall at gymnastics.
How did Jennifer answer the question, do you have any concerns about your child's behavior?
When she gets angry, she has fits of rage.
How did Jennifer answer the question, does anything about your child worry you?
Yes, bio mother's meth use during pregnancy.
Was there any mention of concern of a history of child abuse?
No.
Did Jennifer identify any other areas of concern with regards to Laila?
No.
How did Laila act during the appointment?
She was very quiet. She was being held because she still had a cast on her leg. So she was being held through the entire visit.
And did you also take, or someone at your office take a photo of Laila on that date?
Yes.
Can I approach the witness here?
Yeah.
I'm going to show you what I've previously marked as State's Exhibit 189 and see if you recognize that photograph.
Yes.
And is that a fair and accurate picture of how Laila appeared to you on October 28, 2015?
Yes.
And at this time, I tender State's Exhibit 189 into evidence and ask for permission to publish. And you indicated that Laila was being held the entire time because she had a cast on?
Yes.
And who was holding her?
Jennifer.
Approximately how long was the appointment that you had?
Maybe 20 to 30 minutes.
And were services recommended for either Laila or Millie?
Well, the program itself, the assessment is completed with the developmental screenings, and the monitoring is not a requirement, and so she opted out of that.
When you say she, who is that?
Jennifer.
No further questions, thank you.
I have no questions.
No questions. All right, thank you. You can step down.
Okay.
Objection to this case.
No,
Okay. Thank you.
State call, next witness.
State call, Trisha Blissett.
Trisha Blissett.
Do you swear affirm the testimony you're about to give should be the truth and the whole truth, so help you God?
Yes.
Please lower your hand. You can have a seat. Can you state and spell your first and last name?
Trisha Blissett, Trisha Blissitt.
And Ms. Blissett, how are you employed?
At Gym Tech for Kids.
And how long have you been with Gym Tech?
9 years.
And what are your duties as an employee with Gym Tech?
I am the office manager.
And what does that mean? What all do you have to do as the office manager?
I take care of all the customers as they come in, the parents and the kids. I give them their trial classes. I give them their waivers, their parent information to fill out. I take their money, pretty much everything.
So all the back office stuff.
Mhm.
Are you involved in teaching any of the classes or coaching any of the kids that attend Gym Tech?
No.
And I'm going to show you what's been marked as exhibit number 190. You can flip through and let me know if you recognize that.
Yes.
And what is State's Exhibit 190?
I'm sorry.
What is State's Exhibit 190?
This is, I had to sign it to say that all this information was correct and had not been tampered with or anything.
And is all the information that you provided to our office part of that packet that I just handed you?
Yes.
Okay. Has there been any changes or deletions to any of that information?
No.
State would ask the State's Exhibit 190 be admitted into evidence. Thank you. And Ms. Blissett, when someone comes to Gym Tech, what happens if they're looking to join Gym Tech?
The first thing I do is give them a waiver for them to fill out, because before a child can enter the floor, they have to fill out the waiver. And then if they decide that they're going to sign up, then I give them the parent information stuff where they fill all that out.
So the parent information and the waiver, is there anything else that has to be filled out? And at some point in 2015, did you come into contact with Jennifer Rosenbaum?
Yes.
And what occasion did you have to come into contact with her?
She came up and she asked me if she could do a trial class. And I said yes. I gave her the waiver. She went out to the gym, and I was sitting in there, and I was like, I never got the waiver back. And so then I went out to the gym and I asked her where it was, and she said that she wasn't sure if the little girl was going to do Laila was going to do the class or not.
let me back you up. Was Ms. Rosenbaum, did she have a child participating at Gym Tech?
Yes.
Okay. Do you recall who that child was?
Millie.
And do you recall when she signed up?
Like it's the end of September.
Okay. And I'm going to show you what's part of state's packet number 191. What are we looking at in state's 191? What form is this as part of that packet?
That is a student enrollment form. That's what I give them after they do their trial if they decide that they are definitely going to sign up.
Okay. And what's the date on that form?
September 21st, 15.
So would that have been the date that she did a trial class?
She could have done the trial class that day. Sometimes the parents will go ahead and fill them out and give them to me that day, and then sometimes they'll return them. But that's more than likely the day that she did the trial because that was the first date I believe that we have a payment from her.
And what name was the child registered under?
Millie Rosenbaum.
Did you have any knowledge that of the name of Millie Place?
No.
And who fills out this form?
The parent.
And down at the bottom where it talks about emergency contact, what does that contain? What is that talking about?
That's just like the person that you call if something were to happen to the child or if they didn't get picked up from class and you needed to call somebody or couldn't get in touch with the parent.
And does it contain any other information in regards to insurance?
I don't believe that one does. I believe the other one does, maybe.
Under the emergency contact portion.
Oh yeah, like if we need to transport them, if they get hurt, yes.
And according to this document, who was the insurance provider for Millie at that time?
Jennifer Rosenbaum.
And under what insurance company?
Medicaid.
And at that time, after September the 21st, was Millie in fact enrolled at Gym Tech?
Yes.
And what classes was she taking at Gym Tech?
She was taking one of our preschool classes.
And do you know when those classes took place?
Back then, I believe we had them on Mondays and maybe Tuesdays and Wednesdays.
You said Mondays, Tuesdays, and Wednesdays.
Mm-hmm.
Would the child, if she was attending those classes, go to every one of those days?
No, they come to one class once a week. And her day was on a Monday.
And do you recall what time that class was?
It was, I don't know, not exactly. Mm-mm.
And I'm showing another part of State's 190. And can you tell me what this is that we're looking at?
That is the waiver form that they have to fill out before they can get on the floor.
And was this form filled out?
For Millie?
Yes, for Millie.
Yes.
Okay. And what day was that filled out?
September 21st, 2015.
And for the classes, you indicated that you handled the billing as well.
Correct.
And how much did it cost to attend these classes?
$60 a month. And there was a $40 registration fee.
And was payment made for Millie to attend Gym Tech?
Yes.
I'm showing you another part of State's Exhibit number 1. And what is in this form that we're looking at here?
That's our statements that we have.
And what child is this dealing with?
Millie.
And can you tell me when was the first charge made for the account?
September 21st, 2015.
And what was the charge for September the 21st of 2015?
That $55 is the $40 registration fee. And we had like one class left in September. And so that's a charge of $15. And so then that was what that was for.
And the second charge?
The $7 was for a t-shirt.
And the next charge was when?
September 28th. That would have been like her October payment.
And the charge after that?
November 1st. That was for tuition, $60.
And the next one?
The 15 was for a leotard that they wear when they do gymnastics.
And then the final one?
That was December's tuition.
Okay. And was that amount actually received for December the 1st?
No.
And why not, if you know?
I don't know. They just didn't pay it. She wasn't coming any longer.
Okay. And you talked about the role. Are you in charge of keeping the role as well?
The coaches keep.
The coaches keep the role?
Mm-hmm. Coaches take the role.
Is the role kept as part of your records for Gym Tech?
Yes.
And did you provide a copy of the role for Millie, the classes that she attended?
Yes.
Was Millie signed up for this class?
Yes,
And what day is this on?
Monday,
And what time?
4 to 4:55.
And who makes the indications or notations as to whether or not the child attends?
The coaches,
So any marks on this, would you have made it or would it have been the coach?
the coach.
And saying that the horseshoe states exhibit number 190. What class is this dealing with?
That's the same class, just a new roll sheet.
Now, the top that says class Ravens, what does that mean?
That's just the name of our classes, our preschool classes.
And who was Millie's coach during the time that she was enrolled at Gym Tech?
Natalie Harrington.
Now, was there a second child that was with Ms. Rosenbaum when she would attend Gym Tech?
Yes,
And who was that child?
Laila.
And at any time, was Laila enrolled in classes at Gym Tech?
No,
And did you check your paperwork in order to determine whether or not you had any registration paperwork for Laila
Yes.
Daniel? And did you have any paperwork for Laila Daniel?
no,
At any point in time, was there a discussion regarding Laila participating in the classes?
yes.
Do you recall when that was?
Like October 2015.
And who did you have that discussion with?
Jennifer.
And can you tell me what happened during that discussion?
Yeah, she asked if she could do a trial class, and so I said yes. And so that's when I gave her the waiver and asked her to fill it out.
And did she in fact fill that waiver out?
No.
What happened on that day in regards to Laila doing a trial class?
Okay. When I gave her the waiver and asked her to fill it out, and then she didn't return it to me. So then I went out into the gym and asked her about it. She said she wasn't sure if she was going to take the class because she had been complaining of a hurt leg, and so she wasn't sure if she was going to take it. And I said, well, if she does the class and she goes on the floor, you have to give me that waiver. I have to have it. And so she said, okay. And then I just went back into the office.
And did you ever get that waiver back from her?
No,
Do you recall what date that was?
not the exact date, no,
If I show you a piece of paper, would that help to refresh?
probably.
This is the final page of State's Exhibit number 90, no.
October 19th.
Did you see the defendant, Jennifer Rosenbaum, after that class on the 19th?
No,
Okay. And did you ever discuss whether or not Laila had actually gone out and did the trial class with her?
no,
Okay. Did you at some point find out whether or not Laila had been on the mats at Gym Tech on that day?
no.
When was the next time that you spoke with Ms. Rosenbaum?
I believe maybe the following week or that. She asked me, I guess on the 19th, if I could fill out some paperwork to invoice her so that she could go to DFCS if they would pay if she decided to take classes.
And did you do an invoice for her?
I did.
Okay. I'm showing you the final page of State's Exhibit number 190. Is that the invoice?
Yes.
And can you just walk us through what all of this means on this invoice?
Yeah, that would be the $40 registration, the last class for one class for October, and then 6 months worth of classes. And I was sent it to DFCS. Or she was going to pick it up and take it to them.
Did she ever pick it up?
No,
Did you ever send it to DFCS?
no,
Did Laila ever come in and begin to take classes at Gym Tech?
no.
Do you guys have what's called open play at Gym Tech?
Yes.
And what is that?
That is just as an open gym where they come in with their parent and they just kind of get to have free time in the gym, run around playing, and the parent is with them at all times.
Okay. And when, in 2015, did you guys have open play?
We had those on like Mondays and Thursday mornings,
When you say morning, what time in the morning?
10:30 to 11:30.
And when a parent wanted to come in and participate in open play, do they have to fill out anything?
Yes, everybody that comes in, whether it's a birthday party or anything, but any child that comes into the gym that is going to get on the floor has to sign the waiver.
And did you, to your knowledge, did Millie Rosenbaum Place or Laila Daniel ever participate in open play at Gym Tech?
No,
And how do you know that?
I went back through all my waivers and I never saw their name on anything.
Are you familiar if a child is ever injured at Gym Tech, what is the process and procedure of handling that
We
situation?
have an injury report, and all of our coaches know that they have to fill that out and give it to the parent to sign, and then we keep a copy of it in our pocket.
And I'm showing you the final page of part of State's number, exhibit number 190. Is this the form that you're speaking of?
Yes.
And if a form of that nature was filled out for a child at Gym Tech, who would get that form and who would keep that form?
They would give it to me, and I would follow it.
And did you ever receive any reports of an accidental injury regarding Millie Rosenbaum Place or Laila Daniel?
No.
When the next time, when was it after the October the 19th conversation with Ms. Rosenbaum, do you recall the next time you saw her?
That was probably around the beginning of November, like 2nd November, maybe.
And did you have any conversation with her at that time?
Yes,
And-
that was, she bought a Leo, and I talked to her about the Leo that she bought.
When she came on November the 2nd, did you see Millie or Laila with her at that time?
I saw Laila. The children usually the parents will come see me, and the kids usually just run on back to their class.
And when you saw Laila, what did you observe about her on November the 2nd?
She was holding her, and she had a pink cast on her leg.
Did you inquire about how she ended up with the cast on?
I did not, but our owner talked to her about it.
At any point, did Ms. Rosenbaum indicate to you that Laila had been hurt while at Gym Tech?
No.
Nothing further at this time.
Ma'am?
Excuse me, did you look up the forms under Laila Rosenbaum?
I did both.
And it's your testimony, as you sit here today, that that invoice was not given to Jennifer, correct? Was given to Jennifer, I mean.
The invoice?
Yes.
I don't recall ever giving it to her.
But it's possible you did.
Maybe, but I don't remember doing it.
And there are little slides in your gym, are they not? Short slides on the ground?
Mhm.
And it's fair to say that kids that come and watch their siblings play may wander around and play on some of the equipment.
No, if they're not in a class, they are not allowed on the floor.
But sometimes they do that anyway, don't they? And parents
No.
go with them, and so that's never happened.
Not if they're not in class, no.
Never happened in your entire time.
If they walk out there, our coaches get them. They know that parents, we're very strict about that.
So, let me show you what I've marked as Defendant's Exhibit 123. Let's see if you can identify that.
Mm-hmm. That is a coach with a student.
And who's the student?
That may be Laila. I didn't see the kids a lot, or Millie. I just never, because I'm in the office. I know who majority of the parents are, but like I said, the kids always just go straight to class and have to come out who they are.
So you don't see what happens in the gym. You're in the office, correct?
Mm-hmm.
So if a parent and a,
I mean, I'm all over the place. I'm in and out of the gym.
but so you're not constantly at the gym, correct?
Not constantly, no.
So it's possible that a child got on the floor and you wouldn't know about it.
Well, they could get on there, but our coaches are going to tell them to get off.
But you can't assure us that that actually happened, can you? That the coach actually did come and that Laila did not get on the slide by herself or with the help
Yeah,
of
she
another.
could have done it and they didn't see it, but as soon as they see a child over there, they're going to get them.
But they're handling class, right?
Right, but they will send somebody over there, another coach that's not doing anything, like a
If they
floor
see
manager
it.
or something. Mhm.
This time, Your Honor, I would tender into the record Defendant's Exhibit 123 and ask to publish.
No, Judge.
Now, in that picture, there are 2 levels of bars, are there not?
Mhm.
And do you know what the heights are of those bars?
I do not.
You don't. That ladder is a Jacob's ladder, correct?
Yeah, the ladder is for the team students.
But that ladder is out there, correct? It's accessible, isn't it?
Mhm.
Is that a yes?
Yeah.
And what do you have on the floor? Is that hard plastic like we see at nursery schools and that sort of thing?
The squares, yes.
The squares that they just piece in together?
Mhm.
Okay, so they're not necessarily soft, they're firm, correct?
Mhm.
Is that a yes?
Yeah, they're pretty soft, but they're firm too. Mhm.
And it's correct, isn't it? Would you know if Laila used to sit on the bench or whether she ran around? Would you know that?
I would not know that for every single time she came in there.
Okay, thank you, that's all.
Did you ever observe Laila inside that gym area?
No.
And those mats, is that plastic or what are they made of?
The colored squares?
Yes, ma'am.
They're like the little foam mats that you can get like at Sam's or Walmart or wherever.
Thank you, nothing further.
Let me ask you about those dates that you had it written down for Millie Rosenbaum. Attendance was taken by the coaches, correct?
Correct.
And in fact, November 19th and November 16th, November 9th and November 16th, Millie was not at the, correct?
I don't know. I didn't memorize the.
Okay, let's just see if this helps refresh your recollection.
Correct.
Isn't it true, Ms. Blissett, that November 9th, gym was canceled?
I'm not sure.
Okay, we'll see if this refreshes your recollection.
Okay. That would have been the open gym in the morning time because
But that would have been the gym
just the morning class, not the evening classes.
due to the cold weather, correct?
Because sometimes when it gets so cold and by 10:30, 9:30 in the morning,
It's not
warm enough for the little ones to come in there.
And so you said on November 9th, your heat was not in working condition, correct? Isn't that what you
was
sent out
not.
a Facebook notice, isn't that correct?
I don't know if it wasn't working or if it just had not had time to warm up.
Let's see if this refreshes your recollection.
Well, this says November 16th, November the 8th. It doesn't say the 9th.
Well, isn't the one on November the 8th talking about tomorrow being November the 9th?
Okay, yeah.
Okay, so does it?
So it says it wasn't working, and so that's why they closed for open gym.
Okay. And so if somebody didn't want their children to be in a cold, unheated building, they wouldn't come, correct?
Correct.
That's why you sent out this notice.
Right.
And on November 16th, you sent out the notice saying the heat is still not working, correct?
Yes.
So if a person did not want their children in the cold, they would not come on 11/16 either, would they?
Right.
Nothing.
Okay, thank you, ma'am.
Okay.
You can step down. Any objections to this meeting? Excuse me. All right, and you're free to go. Just an appropriate break. Ladies and gentlemen, we're going to take our lunch break now. We'll see you all back here at 1:15. Thank you.
Vault station, which had one vault.
And when you taught your 18 to 2-month-old class, would they be involved in working on those equipments?
A little bit, yeah, they did. But their parents were with them the entire time, and I was also there, so they didn't do anything alone.
Were kids allowed out on the floor in that 18 to 2-year-old class without their parents?
No, ma'am.
What about without a teacher?
No.
On occasions, would you have kids that would get on the floor that did not have permission to be on the floor?
If at any time a kid ran out onto the floor, we sent them right back to their parent, or we would find them their parent and have them sit with them. They weren't allowed on the floor.
And I'm showing what's been marked in State's Exhibit 191 through 196. If you could look through those and let me know if you recognize them. Do you recognize those?
Yes, ma'am.
And what are they?
It's the gym. It's the preschool area in the gym.
And do they fairly and accurately depict the gym?
Yes, ma'am.
Okay, that as it states, Exhibit 191 through 196 being met.
It's not a true and accurate representation of the gym as it was back then. Our pictures that were taken back then show different placement and different bars.
Am I allowed to say something?
I'm sorry.
Am I allowed to say something?
Did the photograph?
That's subjection. Your response.
Do you recognize these photographs as being fairly depicting what the gym looked like in 2015?
Yes, ma'am.
Okay. Would you change around the equipment for various classes?
Yes, ma'am.
I'd ask the State's Exhibit 191 through 196 being admitted into evidence.
Oh, very good. Thank you.
Behind you is the State's 191. Can you describe what we're looking at here in State's 191?
That is the,
And I think there's a pointer up here or either a laser.
Oh, this?
Yeah.
Oh, you want me to point?
Yeah.
Okay. Oh, okay, so this was the, this is where I would be. So the kids would go in a full rotation, and I would stand here because this part was the more, this could be potentially more dangerous. So this is where I would help them, and then other than that, they would go along these little floor beams on the side just to stay in a rotation. So they would stay engaged.
In States Number 192, what are we looking at here?
This is the vault, so they would go this way. They would all line up here. I would stand down here. They would run down the vault, jump, land, and then they would go this way, and they would do these smaller activities, just again so that they stay in rotation, that they stay focused.
In the very back, you see those that ladder back there?
Yes, ma'am.
Right here.
That?
Was that part of the rotation that your kids would have been involved in, the 18 to 2-year-olds or the 3 to 4-year-olds?
No, ma'am, not unless I took them over there as a group and I would hold them and let them go up and down the ladder. But that was like a special activity we sometimes did if we had extra time in class.
And what's that ladder made out of?
Wood.
And what are we looking at in States Exhibit 193?
From about here over this like line right here, this was preschool, so we didn't do anything with this. But there's the bars. That was also part of their rotation, so they would either start here and they would either grip the bar and swing. Over here it could be something like grip the bar and try to lift your feet up, something like that.
And what age group of kids would be doing that activity?
They would usually do that when they were 3 or 4. The 18 months to 2 years old, they could like pretend to do it if their parents were holding them, but they never did it on their own.
And States Exhibit Number 194, what are we looking at here?
This is like a parent viewing area, so parents could sit here, students could sit here, but it was there was that barrier to try to separate the gym from where the parents could sit.
And that barrier, you're talking about the roping that's there?
Yes, ma'am.
In States Number 195, what's depicted here?
This is just the other half of the gym. This is where the team and like Reck classes and stuff would do their classes. The foam pit's over there, but we didn't go past. My preschool classes didn't go past this over here.
So would there be a reason for the preschoolers to be back over on this other side where the higher bars were?
No, ma'am. Not unless we went to the pit, which was right here, and we would usually only do that if I had a class of like 3 or less, and I could keep them all in one little place, and the gym was significantly empty.
In States 196, what is depicted in States?
So this is the other. Oops,
Sorry.
you're fine. This is the other half of the beam station. So right here, they can maybe walk across this, do a bear crawl here, you know, hop over some like little individuals here, and then this is where I would be to help them again.
And what, in States Exhibit 196, this slide here, how would that be part of the rotation?
So that's like a filler. So we would have, right here is where we would do like a front roll, which would be like what we would be working on. So we'd have one main thing we were working on, and it would be like a front roll for the week. The other activities here are just to keep them in rotation so that they could go up the slide and go down, and by the time they come off, they'd be ready to stay in line.
And then States Exhibit 197, what's depicted in that?
This is just the floor of the gym where the rec classes and stuff take place, the older classes.
Now, did you have an occasion to teach Millie Place, or Millie Rosenbaum as she was registered?
Yes.
Thank you, the lights can come back up. And do you recall when that was that you taught classes with Millie?
It was fall of 2015, so I believe it was September, October time.
And what days would Millie take class?
She had class Mondays.
And how long was that class?
55 minutes.
And did you take roll for that class?
Yes, ma'am.
And I'm sure what's already been marked as States Exhibit 190 and admitted to evidence. What are we looking at here?
That's one of my roll sheets.
Okay. Is that your name at the top?
Yes, ma'am.
And do you see Millie's name?
Yes.
Okay. And can you tell me, based on that attendance roll, what days did Millie attend?
Where all the check marks are.
Okay. Well, can you just tell me those dates?
Oh, yeah. Let me see. 9/28, 10/5, 10/12, and 10/19.
So this is the second page.
11/2, 11/9, and I'm sorry, just 11/2. She didn't come those 2 days.
So where there's an X on this States Exhibit 190, what does that indicate?
That she wasn't in class.
And you would have made those notations?
Yes, ma'am.
How would you describe Millie when she was in your class? What type of little girl was she?
She's very sweet.
Did you ever have any issues or behavioral issues with Millie while she was in your class?
She was very well behaved.
Did you ever have any issues with her running off and being involved or getting on any of the equipment that she was not allowed to?
No.
Do you recall who Millie would attend classes with?
She had class with Macy,
Okay.
another little girl.
Did you have any other kids in your class?
No. I want to say when she was coming, it was down to like just her and another girl in that class.
Okay. And I just want to show you what's been entered into evidence in State's Exhibit 123. Do you recognize who that is?
Yes,
Okay, who's that?
that's me and Millie.
And that ladder that we talked about earlier over there, did you ever have an issue with Millie going over and getting on that ladder without your permission?
No.
Do you recall it during your class, did y'all ever, you said that would be like a special activity, if at any time you guys went over and used that ladder as part of that special activity?
We have, yeah, we did.
Were there any incidents that you recall if Millie ever fell off or fell down or had any issues on that equipment, that ladder?
No, I don't recall. I don't think so.
If she had, let me ask you, when Millie was in your class, did you ever have any instance where she got hurt?
Not in my class.
If she had gotten hurt in your class, what would you have done?
We would file an injury report.
And during the time that Millie was in your class, did you ever have to file an injury report concerning Millie?
No.
And I think I asked you, who would bring Millie to class?
Ms. Rosenbaum.
And did you know Ms. Rosenbaum prior to Millie attending Gym Tech?
No.
Did you ever have any interaction or conversation with Ms. Rosenbaum?
A few times.
And what would you be talking with her about?
Usually just about Millie in class. And I just remember one conversation we talked about her family being from South Dakota, because my family also is from South Dakota.
And do you recall Millie's last class with you?
Like the date?
The date, yes.
I don't know the date off the top of my head.
If the last date you have checked off on this roll sheet is November 2nd.
Then that would have been it then.
Do you recall anything that sticks out of your mind about the last time Millie attended your class?
Yes.
Can you tell me what that was?
She had a very large bruise on her face and on her eye.
And when you saw that bruise, what did you do?
It was significant enough that I was like, oh my God, like what happened? And I asked her, and she said, oh, I fell getting out of the bathtub.
Did you ask her any more questions about that fall?
I asked her again later when we were alone, like we were kind of away from her foster parents, I suppose.
So let me ask you, the first time you asked her, who was present?
It was me, Millie, Macy, and her, Miss Rosenbaum was in the general vicinity, so I moved away later and I asked her again. I said, what happened? How did you get that huge bruise? And she said, I fell getting out of the bathtub.
Why did you feel the need to ask her a second time?
It was a very large bruise. It was huge.
And you said her foster parent. How did you know that Ms. Rosenbaum was her foster parent?
I actually wasn't made aware of that until after the incidents have occurred.
So prior to that, who did you think Ms. Rosenbaum was to Millie?
Her mother.
And to your understanding, what was the name that she was registered to attend Gym Tech under?
Rosenbaum.
During the time, you said you taught at Gym Tech for about 3 or 4 years. During the time that you were teaching, have you ever had a child to get injured?
No, not significant.
What type of injuries have you seen?
Maybe they tripped and skinned a knee on the carpet, something like that. Nothing, no broken bones, nothing.
Okay, thank you.
Ms. Harrington, you wouldn't speak to us, correct?
Ma'am?
When we called you, you did not want to speak to us, isn't that correct?
Yes.
Now, with regards to this conversation that you had with Millie about her face, there being a bruise on her face, did you tell that to the police?
I did not.
You did not mention that to the police, but you did give a statement to the police, didn't you?
Yes.
And you never mentioned to them this conversation, did you?
I did tell them. I told the police when they asked me about if I'd ever seen any bruises on the girls. I told them that I'd seen a bruise on Millie.
And who did you tell the police?
Who did I tell?
Yes.
Whoever was, I told the police.
You don't know who it was?
No, I don't remember.
You don't remember if it was Detective Thompson?
I'm not entirely, I honestly don't remember the name. It was a few years ago.
And you told them that you had seen a bruise that was large enough that you thought it was significant?
Yes, ma'am.
Tell me, did you call the police at that time, at the time you saw the bruise?
I did not.
Did you talk to Miss Matheson about that?
I did not.
Did you call DFCS?
I did not.
I'm sure what I've marked as defendants exhibit 59. See if you can identify that. What is that picture of?
That's me and Millie and Macy.
And Macy.
Yes.
At this time, I would attend defendants exhibit 59, which was taken on October 12, 2015.
No objection.
Tell us which one is Millie and which one is Macy?
Millie is the little one with the black and green. and Macy is in the pink.
Nothing further to say, Ms. Hughes, how old were you back in 2015?
I was 16.
All right, thank you, ma'am. Please step down and you're excused unless there's an objection.
Nothing to say, ma'am.
Any objection from the defense?
No, I just asked that she remain available for the call. We've got another witness that's going to testify. You may have questions for.
All right, ma'am, this means is that you're being released today from these proceedings, but you may be called back at some point later. And so just make sure that you're available, okay?
Yes, sir.
Thank you. Let me tell our pool provider, our pool coverage provider, that if there is a question from the media, you can just write it down on a piece of paper, give it to the sheriff's deputy, who will then send it to me, okay? If we can handle it that way, it allows me to give you a more timely response.
Thank you, call Maria Madison.
Yes, ma'am.
Ma'am, can you please raise your right hand? Please, do you swear to affirm the testimony you're about to give should be the truth and the whole truth to help you God?
Yes, I do.
You can lower your hand and please state and spell your first and last name. You can have a seat.
Maria Matheson, MariaMatheson.
And Ms. Matheson, are you familiar with Gym Tech?
Yes, I am.
How are you familiar with Gym Tech?
I am the owner of Gym Tech.
And how long have you owned Gym Tech?
10 years.
And do you have a background in gymnastics?
Yes, I do.
What's your background?
I took tumbling and gymnastics when I was growing up, and I've done coached gymnastics for the last 18 years and done training under USAG.
What's USAG?
USAG governs the Olympics for gymnastics. So I'm a safety certified professional member and preschool fundamentals 1 and 2 certified trained.
Prior to owning Gym Tech or now, did you own any other, businesses that involve teaching gymnastics?
Yes, I helped run a mobile gymnastics program called Gym Kids Express here in Henry County, and I helped run that for a few years.
How long did you run that?
I believe about 5 years.
And can you tell me a little bit about how that program worked?
Gym Kids Express was a mobile gymnastics program. We went around to daycare and childcare facilities, and we coached ages 3 and 4 inside the daycares or private schools.
Did that involve working with kids using equipment at all?
Yes, ma'am. So we would take in our own equipment and we would run classes within the facility.
What type of equipment would you take in?
Balance beams, preschool fundamental equipment like tunnels, wedge mats where you could do forward roll, backward rolls. We would take in like a low bar where they could just learn how to grip onto a bar, which is like a little floor bar. And panel mats where they could just do like forward rolls and tumbling on.
Did you ever have occasion during the course of time that you were doing the mobile gym where you had a child to be injured?
No, ma'am.
And besides teaching gymnastics at Gym Tech, do you have any other gymnastic teams or competitive teams or anything of that nature?
Yes, ma'am. We have a competitive women's gymnastics team and a competitive men's gymnastics team.
At what age do kids get involved in, the competitive gymnastics?
They can start training in a invite-only class at age 4. And then they actually don't start competing until age 5.
And what type of equipment would someone, let's say if they're 4, would be utilizing if they were on the competition team?
They would be utilizing more of our preschool area equipment, still working with the preschool bars, the balance beam. They may go to the beams, but they would be lower down for that age group. They would also vault, but on a preschool vault board.
And if you were 2 years old, would you be involved in a competitive gymnastics?
No, ma'am. For the age 2, we only offer a parent and taught class, which is a parent-assisted class. So the parent has to remain with the child during the class.
And showing the State's Exhibit number 192, and you can see it behind you. Is that the vault you were just talking about?
Yes, ma'am. It's a preschool vault.
And in your gym, are there certain safety precautions that you take?
Oh, yes, ma'am.
Can you tell us about those?
Well, we take safety precautions as far as making sure that there's mats in the proper place. On the equipment, make sure we do an equipment check, that the bars are stable, everything's locked in. There's screws when you adjust the bars that you have to, or knobs, you have to make sure you tighten the bars up. Just making sure mats and everything are properly placed as far as when you're talking about training on the equipment.
And can you tell me about the mats? Kind of like how are the mats made? What are the mats like in your
gym?
gym?
We do have the squared foam mats.
that you piece together. And then underneath, if you were on a bar, you would have another mat up underneath that bar on top of those mats as well.
It'll show you. It states exhibit 191. Do you see kind of that setup where you're talking about the bars and the mats?
Yeah, so if you look at this bar right here, that's about a 4-inch mat that is up underneath that bar. And the other bar is probably about a 1 to 2 inch mat up underneath that bar. And then of course you can see the length of the bar is making sure that it's covered enough in front of the bar and covered enough behind the bar.
And what about any other, do you know what the thickness of those mats are that are utilized at your
The
gym?
one is a 4-inch mat, and the other one's about a 2-inch mat.
Okay. And what about those foam puzzle pieces?
The puzzle pieces are probably only about maybe 1 inch thick.
And let me ask you in regards to taking precautions, how does the setup for a class go? Does it once it's set up, does it remain the same, or does that change, and who does it and how?
Typically, it stays, the setup at the gym stays the same with the mats. The coaches, we do 7-to-1 ratio, so no more than 7 students to 1 coach. They are set up in rotation circuits, so there's a lesson plan for each week, and they receive that lesson plan, and there's a circuit. So for instance, you took it down. There would be, okay. So if you see right there, that's a beam circuit. So if where the higher beam is would be a coach would be there because that's a higher, more difficult skill.
And I'm going to hand you this.
Sorry.
Press that little button. It makes that little red laser come up.
Okay.
Press it at the top.
Oh, press at the top. Thank you. Okay. Not sure if I have it right here. Yeah, there we go. Okay, so this is a higher beam. So this is going to be a coach-assisted skill, meaning the coach is going to be right here assisting the athlete across the beam so that there's no injury, just because this beam is raised up a little bit higher. So you can catch if there was a ball or anything like that. And then they're going to go down over here and they're going to do another skill on this beam. And you can't see in the picture, but there's another beam that runs across that way and then the beam that comes this way. So the coach would be here assisting the child across, watching this area, and they would go around and come back up the stairs and go. That would be a circuit, a station.
Okay. And you said your ratio is 7-to-1.
7-to-1.
Okay. And what about the training, any other safety precautions that you take as far as the gym equipment is concerned?
As far as the gym equipment is concerned, it's just always making sure that the coaches know to come in, make sure the mats are placed properly, the beams are where they are, the mats are up underneath the beam, checking the bar. Usually coaches aren't adjusting the bar. Typically it's set up for their class for that circuit for the day.
And how often are those safety precautions taken as far as making sure the bars are locked, the mats are in place? How often does that happen?
Every class, every day as they come in.
Okay. And what about training for your staff? What type of training do you provide for your coaches?
So I'm preschool fundamentals certified trained in preschool fundamentals 1 and 2. And then I have a partner that works with me that is a national judge under USAG. So we've also attended the World Congress training that USA Gymnastics offers. And then we bring that in with our staff. We've also had from time to time, they come to our facility and have offered training at our facility, which is preschool fundamentals 1 and 2 certification, proper ways to coach, safety certifications, those type of things.
And are you familiar with someone by the name of Natalie Harrington?
I am.
Would she have gone through that training as part of being an employee with your gym?
Yeah, so she would have gone through training. We start training, we do a full extensive training in the summer before we start our fall session. Mm-hmm. And we do another coaches staff meeting. We do training again, usually around December before we go into our springtime training. And then we've also had, like I said, I believe Natalie did participate in when we had the outside certified coaches come in and they do where you receive a certificate for participating in a preschool fundamental training class.
And are you familiar with Michaela Stone?
Yes, ma'am.
And who's Michaela Stone?
Michaela's one of my coaches as well.
Would she have also gone through this training that you just described?
Yes, ma'am.
Okay. Let me ask you, in regards to injuries at your gym, have you ever had occasion to have a child injured at the gym?
Yes, we've had children to be injured.
Okay. And what is the process and procedure if a child is injured?
There is a injury report, and they are to fill out the injury report. And then the injury report has to also be signed by the parent and the coach.
Okay. And when you talk about injuries, how many injuries would you say you've had at your gym?
Well, it depends on what type of injury you're asking.
Let me start there. What types of injuries have you seen happen with kids at your gym?
We've seen anything from a knee scrape to I've seen more injuries with our competitive gymnasts that have actually had like a break, talking more on the competitive side.
Let's talk about your kids that are in your mommy and tot class.
Yes.
Any injuries there, and if so, what type?
No injuries in a parent tot class.
And what about the 3 to 4 year old class?
3-year-old 4 class, nothing other than maybe a knee scrape or a fall down and maybe a child complaint. But even if it's a fall in a complaint that's made by the child, or they say, oh, I hurt my arm, or I hurt this, I hurt that, the coaches are still required to fill out an injury report because we can't tell if there's an injury there or not specifically. So they're still required to document it down so that we have it on file. And we're required to do that by our insurance as well.
And when, as far as your Mommy and Me class, how often would those classes be run at the gym? Let's say back in 2015 specifically, how many?
During that time, we only had one parent and talk class.
And on what days was that class held?
I believe on Monday, we had a parent and talk class on Mondays.
And if a parent was interested in having their child attend, what procedures did they have to go through to participate in the class, even for the Mommy and Talk class?
Okay, so we offer free trial classes. Anytime you come in for a class, you have to check in with the front office, sign a waiver form, give your information, and then they can participate in the class.
And I think we talked about this equipment, these bars, for a parent and Talk class, these bars here. Would kids be participating or be involved in using that particular equipment?
Yes, they could be. So at a parent and taught, really actually a child's hand cannot really fully grip around the bar. But what we do is teach them to do a reach to the bar and try to grip onto the bar. And then we would have them like do something as maybe try to pull their knees up. And we usually instruct and show the parents that they're just going to try to lift their feet up off of the bar, which is kind of working that core area. Most children at that age are still trying to figure out how to use their core. So that's really what that is for. We also would show the parent that they could put their arm up underneath the toddler and just kind of try to do a swinging motion. But you really have to hold on to them because they're really not, their hands are not large enough to fully grip around that bar.
Do you know what would the height of those bars be set at for a parent and Talk class?
Somewhere around 40 to 45 inches from the ground up. Well, if you went from the bar up, or it would depend on the mat. So if the mat's under there, it might be around 42 inches with the mat. So it depends on if you're counting it from the bar, from the floor where the base is to the top of the bar, or if you're going from the mat to the top of the bar.
So let's say from the mat.
I'd say 40 to 45 inches. Okay. Probably somewhere in there.
From the mat to the bar.
Yeah. Okay. But the goal is to make sure that the child can stand on their feet and hold the bar from their feet. Okay. Nothing above.
And are children or parents allowed to, let me ask you, are children allowed to be out on the mats or on the floor or any equipment without a coach or a staff member from Gym Tech?
No, ma'am. They must be enrolled in a class in order to be out on the floor.
Have you had occasions where kids would run out, say they're there with a sibling, and run out and get on the equipment or anything of that nature?
Of course we have. And we have all the coaches and staff are instructed to immediately let them know that if they're not involved in a class, you must step off of the floor. And that's a continued process and watch at the gym. I usually have several coaches there, so everybody knows, you know, if you don't see them actively involved in a class, then they shouldn't be just freely running around the gym.
Would parents and children have access to the inside of the gym and be on the mats without a staff member being inside that gym area?
No, ma'am, they should not be.
And in 2015, did you have a free play?
We had an open gym play.
Open gym, okay.
Yes, ma'am.
And to your knowledge, do you know if Millie Place, Rosenbaum, or Laila Daniel ever participated in your free play or open play?
Not of my knowledge. I didn't have any record of either one of them attending open gym play.
Okay. Do you recall ever having any interaction with Laila Daniel?
Yes, I do.
And what about Millie Rosenbaum Place?
Not any really interaction with Millie other than just visually seeing her in a class.
And were you working on October the 19th of 2015?
Yes.
And to your knowledge, on what day of the week was that?
Monday.
And was Millie Place, I guess, enrolled at the gym?
Yes.
And to your understanding, did you ever meet the defendant, Jennifer Rosenbaum?
Yes.
And when Millie would come to the gym, who would she be brought by?
As far as I knew, she was brought by her mom.
Okay.
Yes.
And when you say as far as I knew she was brought by her mom, what do you mean by that?
Jennifer.
Okay. And would Laila Daniel be present during that time, during those times?
Yes. Yes.
Did you ever have an opportunity to observe Millie Place while she was involved in class when she was there?
Only for briefly between walking in the gym and around and visually looking over and then going to my office. I didn't really sit in on the actual classes. So usually I was coming into work during that time and would just be going straight to the office and would be visually seeing what was going on, or kids in classes or parents on the bench, that type of thing.
What about Laila Daniel? Did you ever have an opportunity to observe her during the times that Millie would be in class?
I didn't observe her like in the gym.
Okay. Yeah, that's what I mean. Let me ask you this.
I didn't observe her in a class ever.
Okay. Did you ever observe her in the inside of the gym area where class would be going on?
No.
Okay. And were you involved actively teaching these classes during the time that they would be going on?
No,
Do you recall ever getting any reports in regards to Millie injuring herself at Gym Tech?
no, ma'am.
Was ever any injury reports filled out?
No, ma'am.
And what about Laila Daniel? What was your interaction with her?
I met her when Jennifer had come to the office inquiring about wanting, my office manager, Tricia, had called me asking if it was okay to do a 6-month out billing. She wanted my approval if that was okay to do that. She explained there was a defect situation, and would that be okay? And I said, yes, absolutely, that would be fine. I came in one day and Jennifer was there trying to handle the paperwork with Tricia in the office, and that was my first encounter with her and Laila at that time.
Do you recall what day that was?
I believe it was November 2nd.
And where were you at when you encountered the defendant, Jennifer Rosenbaum?
So I was actually in my office, so there's a window, so you have to go out of the office to the main lobby area, and there was just a window there. And she was trying to handle paperwork with Tricia, and I could just heard Laila crying during that time, and I was on the opposite side.
When you say it's a window outside, is I guess the gym area where kids will be having class or practicing, is that in a separate area from where the office area is?
Yes, ma'am, separate area. So we have a large lobby with some offices within that lobby, and then we have separate doors that enter actually into the training facility.
And you said that you observed the defendant, Jennifer Rosenbaum, with Laila.
Yes, ma'am.
And what was Laila doing when you observed her?
She was crying, just crying and really upset, and she was trying to handle business, and I just naturally kind of take the kids, and I know as a parent, you're trying to take care of some things, your child's crying, I just kind of went around the corner to calm or comfort or cheer her up.
And what happened when you went around the corner to cheer Laila up?
I went around the corner and noticed she, had a cast on, and she was just kind of continuously crying, and I just said, oh my goodness, and it's okay, and I said, wow, what happened? That's a big cast, just kind of talking to her like that, and asked, and I didn't really get a reply just other than, oh, she's just upset because the doctor said she needs to walk on it, and she's mad because she doesn't want to walk.
Who were you asking about what happened? Were you talking to Laila when you asked about what happened, or were you talking to the defendant?
I was kind of looking at both, and kind of looked up, at the mom, and she was talking to the office manager, and then just turned around and gave me the reply and just said she's mad, she doesn't want to walk on it, but the doctor said she needs to get used to walking on it, and she spoke that directly to me.
Did she ever mention that the injury had occurred at Gym Tech?
No.
What happened after, I guess, were you able to calm Laila down?
A little bit. She kind of calmed down a little bit, and she and I were kind of talking, and I was just trying to play with her, and Jennifer, I guess, finished up her paperwork and got all that done, and, explained, I guess she was not going to be doing any classes or whatever, and then I just said, I introduced myself to her. I said, I'm Maria Matheson, I'm the owner, so if you ever need anything, just let me know. Excited you guys are here, and that was pretty much it.
And at the point that you introduced yourself as the owner, did she ever mention about the injury of Laila occurring at the gym?
No, ma'am.
Where was Millie during this interaction? Was she there?
She would have been in class.
At some point, did, I guess, my office come out and ask you to do a video of a mommy and tot class for us?
Yes, ma'am.
Okay. I'm going to show you what's marked as States Exhibit 197. Do you recognize that?
Yes, ma'am.
How are you able to recognize it?
I initialed it the moment that they did the video into the disc, and they asked me to view it, and then I initialed and dated it.
Were there any changes or deletions or modifications to it?
No, ma'am.
State with us the States Exhibit 197 be admitted to evidence for demonstrative purposes.
The next sole objection would be whether it was done during the time frame of 2015. It wasn't done objected.
I can play a little bit further foundation. When we asked you to do this demo, was it in conjunction with how class was run in 2015?
Yes, ma'am.
Had y'all made any changes about how you run a parent-taught class since 2015?
No, ma'am.
Okay. I'd ask that States Exhibit 197 be admitted.
Yes, it may.
Thank you. May it be published.
You may.
possible technical difficulties. We're trying to work on the sound. Can you tell me what we're looking at in that first video, Ms. Max?
So that's a parent-assisted class. So if you can see, that's the parent there helping. So she's reaching to the bar, and then the parent's trying to assist her into grabbing the block with her legs, and there again to try to lift it with her legs or work on that core strength. But there again, like you can see, if they weren't able to reach the bar, there would be another mat up underneath them so they could actually reach up to the bar. But you want the child to be able to reach onto that bar and hold. And there again, the parent's right there with them, assisting them through that skill.
And when you did the demo, did you do a whole class, or how did you go about doing these demonstrations for us?
This was actually a class that was in progress that was videoed.
And before you talked about doing various different, you said the beams, that was a beam cycle. Would the kids go through the same cycle every class?
So usually they're going to hit anywhere from 3 to 4 what I would call stations at a time. So like a beam station, a bar station, and like a tumble station. Okay, so each station, they're going to spend maybe 10 minutes at a station, depending on how the class is going with the children listening and following direction and all that. As they get a little anxious, then we might move on to another station to redirect them.
And I guess, do you do the same stations for every class, or does it change from week to week as to what you're
We do have lesson plans, so typically every 2 weeks the lesson plan will change.
And who comes up with that lesson plan?
So under, there is called a hands-on training where you can actually purchase flip preschool training. You can actually purchase lesson plans. So we have lesson plans that we actually purchase, and there's some you can purchase through USA Gymnastics as well. So we would go by those lesson plans and just redo them. They have like actually themed months and different things like that.
In the video we were watching just a few minutes ago, what age group of class is that?
The one that we just had up was a parent and taught class.
And what are the ages for that parent and taught class?
18 months to age 3. So they can't go into class by themselves till they're 3.
So if Laila was enrolled at Gym Tech during the period of time of 2015, if she was 2 years old, she would have been attending in that type of class. Is that what you're saying?
Yes, correct. She would have to attend a actual parent and taught class, a parent assisted class.
Now, prior to the parents coming into the class, are they given any training of how to work with their kids, how to hold them, or anything like that during that during the time that they will be participating in the class with the kids?
Yes, so what's going to happen is when they come in and before the coach does the station, the coach is going to show the parents what is going on at each station. For instance, if they were working on forward walks, they might say down beam 1 is going to be a forward walk, down beam 2 is going to be sideways, down beam 3 is going to be a backwards walk, and beam 4 will be a spotted kicks with the coach. So they're going to let the parent know what to do. If it's like forward rolls or something like that, then they're going to let them know to support the head. But generally, we try to let the staff do anything that needs to be spotted.
Yeah, take person do I think we're going to talk. And how many videos did you So what were we observing in that second video?
So that would have been working on a front support, and as you can see, there was another elevated mat up underneath of that so that her feet could still make sure that they were coming down. So being as she was pressing up and going slightly above the bar in a front support, you wanted to make sure there was another mat there so she didn't have, if she was to come off of the bar, it wasn't as far of a drop down to the other mat. So that was just basically working on a front support. And they're again supported by the parent, holding at the waist, supporting the front support and helping them down off of the bar.
Is that the same thing we just looked at?
Yes, ma'am. So the parent supporting underneath the arm, making sure that the child's coming down safely off of the bar. Are you wanting me to explain these? I'm sorry.
So was that the same, trying to get that child?
So that child was a little bit smaller. So if you could see, the actual coach was there trying to show how to grip the bar. He wasn't quite realizing how he needed to grab onto the bar. So she's helping, trying to show him how to grab onto the bar.
And was that, is that the same mat setup that you were talking about before?
Yes, and there again, as you can see, he's right there at height of the bar. That's why the additional mat is set up underneath of him. So there's actually 2 mats there.
Do you recall how many kids were in this class?
I believe about 3 or 4 maybe.
So what are we observing in that video?
So in the scarf, it's basically trying to teach a child how to grip an object with their feet, use that cord to lift their toes up, which would be another skill as they advance on. They would then probably in the following 2-week lesson plan, it might have been where they grip the bar instead of the block, they're grabbing onto the scarf and trying to pull their toes up holding the scarf. So that was basically just a core strength training, hiking up, grabbing an object.
And what are we observing in that video?
That's a balanced beam rotation. So as you can see, the beam that's inclined, that's actually the coach instructor that's with the child there. So they had to walk up an incline beam just to get them used to the height. And then they were able to tap or grab the balloon or kind of play with the balloon once they made it to the end of the beam.
And what were we observing in that one?
That's a tumbling station. So there again, just working on strength training, motions. They're incline again, inverted, like an inverted drill on that round dome is a mushroom. Getting the child used to going upside down. If you saw, then they went to the incline mat where they inverted and actually rolled over with the coach. So there, that's an inversion drill.
And what were we watching here?
That was a cartwheel, so the other mat that you could see, the first 2, what we call our French fries that were on the floor, there again, that's an inversion, placing the hands down, being able to hop over a French fry. And then the next one was going into working on like a cartwheel, trying to teach them like a cartwheel. So feet down, hands down, and then a hop back over to the feet, which is, there again, also an inverted drill.
what are we observing in that video?
So that's a vault drill. So they're learning how to run down the vault runway, jumping off of the vault, of course, onto a mat. And then that was probably crawling down or hopping down the yellow line across the hearts and back around.
And what's depicted in that video?
Excuse me?
What was shown in that video? What was
That was just a view of the entire, pretty much the entire facility where training's going on. There were a few of the competitive athletes in there, other recreational classes that were going on, tumbling class. There was a station on the tumble track, and it looked like regular classes running on the opposite floor as well. And then parents' observation area.
Do they ever, the classes, the competitive team or recreation, are they ever intermingling or mixing together while they're there inside the gym? Like, are they working on the same equipment at the same time?
Not the same equipment at the exact same time, no.
And what's in that video?
That was team training on the actual floor. On the trampoline area was another class that was going on. I can tell that because it's mostly boys. So, and then on the opposite floor, it looked like another team training group, and then there was recreational class.
And would the parent top class ever be able to mess up?
No, ma'am.
Is that another overall view of the gym while class is going on?
Yes, ma'am.
Nothing further than something to certain
Ladies and gentlemen, there's been a request for a 5-minute break from the grant. So just take us the opportunity for stretch break. We'll see you back in the 4 minute moment. Thank you. Okay, any housekeeping from anybody?
Okay, so I'd let them know about what we discussed at the venue.
Okay, and I'm sorry, what did you say?
I'd let them know about the X-ray matter. So I don't think they had any further inquiries on that.
And what did you say? I'm sorry. What did you tell them?
Sure, just that they were, that the court had no objection to them showing the X-rays.
That's correct. Yes, all right, thank you.
Oh, yeah, I'm sorry. You can take a stretch break too.
Some questions I'd like to ask you. If you don't hear me or if I'm not talking loud enough, please let me know. Okay? You're the owner of Gym Tech for Kids.
Yes, ma'am.
And it's your testimony, and I want to make sure that I heard you correctly, that you would always keep a mat, you build up the mats so that the child could reach the bars, correct?
Yes, unless it's a progression, then they can go up, or there could be progressions within the lesson plan, but there's always some type of mat underneath the bar.
Okay. And when you stack the mats up, it's so that the child can reach, standing up, can reach and hold on to the bar, correct?
It depends on the skill and the age of the child.
Okay, let's talk about children Layla's age. You would build it up so that they could reach the bar and hold on to it.
Yes, ma'am. So if it's an instructed lesson plan with us, then it typically is going to be where they can reach the bar. If there's always so the mats that are always down, the color block mats are always there, no matter what. So there's never going to be a bar placed on the concrete. There could be a lesson plan where the parent is able to lift, but their feet should not be hanging far from the mat or even the square mats, the colored block mats that are down. The bars always remain on top of those mats.
And the child, therefore, should be able to stand and reach the bar.
They could stand and reach, or if it's a parent-assisted class, the parent could also pick them up and allow them to grip the bar.
And in that case, there would be more distance between them and the
Shouldn't be
floor.
any more than like a maybe 2-foot distance between.
Let me show you what I've marked as exhibits 127 and 128. Take a look at exhibits 127 and 128 and see if you can identify those pictures.
So that's like an actual instructor that is holding her up. So that's an
Tell us,
instructor.
first of all, identify the photo and then we can show it to you.
Oh yes, I identified the photo.
It's a photo of what?
My instructor holding a child,
Okay.
and then
number 128?
and that is a mat with a vault board up underneath the mat, and looks like she's assisting her down from the bar.
This time I would tender 127 and 128 into the record and ask if I may publish. Tell us what we're seeing here.
So that's working on teaching the child to jump from a vault to reach to the bar. So that's a instructor assisting the child on that particular skill. So they would go up the incline of a vault and jump and try to reach to grip onto the bar, spotted by the instructors.
This here is the vault, correct?
Yes, ma'am.
There's no mat on the vault, is there?
Yes, it's a carpet padded. That's carpet padded. It's not solid wood.
But it's carpet padded, but there's no foam mattress on top of it, no foam mat on top of it, is there?
That's not a foam mat, but there is
Carpeting.
a thickness in it.
And the child cannot reach from...
On her own, no, but she's being assisted with an instructor.
If she were to fall, we're talking about 2 or 3 feet.
Well, the instructor wouldn't let her go to hang by herself. So she's not left alone by herself. If you went and dropped and her arms were actually hanging straight and her feet were hanging down towards the vault, you would only have a couple of feet between the vault and her actual feet.
And then you would have about 5 or 6 inches from the vault to the mat.
Yes, there's the vault and there's another mat up underneath the vault.
And number 128, tell us what we're seeing here.
It looks like she's about to prep to teach her to prep to go up and to teach her to reach and grip to the bar. Either that or she was bringing her down from the bar.
Ms. Madison, on November 2nd, you say you saw Laila cried and tried to comfort her, correct?
Yes, ma'am.
And you didn't notice any bruises or marks on her, did you, other than her broken leg?
Well, she had on, her cast completely covered her leg and she had on clothes, so no, not to my recognition. I don't remember seeing any additional bruises or anything.
Let me show you what I've marked as 126. And ask you if you can identify this photograph.
It's a child climbing up the steps.
Okay, thank you. At this time, Your Honor, I would tender 126 into the record and ask if it may be. No objection.
And maybe you can also.
Let me show you what I marked as 124 and 125.
Let me just show you that.
Oh, I'm sorry. Surely it must have been marked as 124 and 125. See if you can identify those by number, please.
What specifically are you asking me to identify?
What are these pictures of your gym? Are they pictures of somebody else's gym?
No, these are pictures of my facility.
Okay, and are they true and accurate copies of, do they truly and accurately represent your facility?
Yes.
At this time, Your Honor, I would tender defendants exhibit 124 and 125 into the record.
State would object to 124, no objection to 125.
Your Honor, if I may, Coach.
I heard that the foundational response was that they truly and accurately represent the facility.
The state's objective is as to relevance to this particular case, Judge. I don't know what that particular case represents as relevant to the facts in this case.
Your Honor, this is no different than showing video of children climbing up and down on apparatus. This is just a still photo.
All of it, 124 and 125.
Fine. Your Honor, this time I'd ask if I could show it. About how old is this child?
The picture is kind of blurred, so I'm assuming maybe 3.
Okay. And is this an accurate reflection of something that transpired at your gym?
Yes, looks like a child training an Arab basque on a balance beam.
In 125?
And that child looks approximately 3 to possibly 4. And she could also be, looks like it's one of my more advanced students by her body position is in perfect form. So that looks like more of a advanced
3-year-old?
3 to 4-year-old doing a front support with straight legs, pointed toes, and a perfect arm position with a mat up underneath her.
Is this not in fact Allison Heath? Is this not in fact Laila Heath?
Her face is down, and I have about approximately 400 students plus in my facility, so I wouldn't be able to say specifically if that's Allison Heath.
I just have a moment. Nothing for you,
Oh, anything else?
Just your questions. Ms. Matheson, exhibits number 127 and 128. To your knowledge, did Laila Daniel participate or involved in any of these exercises at your gym on October the 19th of 2015?
No, ma'am. To my knowledge, I don't know if her, other than that she had inquired about doing a class, my office manager, Tricia, informed her that she needed to sign a waiver form.
Object to any testimony about what the office manager said to her.
Response?
I'll move on without telling me what someone else told you.
It was to my knowledge that she had inquired about doing a class. She was asked about the waiver form. Later when, okay, sorry.
I would object as to what he calls for her to testify as to what somebody else told her, where she got her knowledge from.
I'll ask you a different way.
All right.
Did you ever observe Laila Daniel doing the activities that are depicted in Defense Exhibits 127 and 128?
No, I never observed Laila doing any class.
What about in Defense 126?
I never observed her doing that either.
Defense 125?
I
You never
never
observed Laila Daniel doing any of that at your gym?
No, I did not.
And Defense 124?
No, I did not.
To your knowledge, did Laila Daniel participate or be enrolled in any classes at Gym Tech?
She was not enrolled in any class at Gym Tech.
Thank you.
Isn't it in fact true, Ms. Matheson, that she took a trial class?
She did not sign up for a trial class, nor did she sign a waiver to participate in a trial class.
But you don't know that she didn't take a trial class?
My coach informed me that the parent...
Objection to what somebody else told you?
But Judge, she asked the question. I think she should be allowed to answer.
Overruled.
My coach informed me that the parent or guardian took her out on the floor for approximately 2 rotations, and the child continued to cry, and she took her off, saying, I don't think she's going to do it. But she never signed up for the trial and never turned in a waiver to participate in a trial class.
But you did participate in 2 rounds of a trial class.
According to my coach, the parent took her out on the floor.
Thank you.
Those 2 rounds that she participated in, did it involve the beam, the bar, or involved?
To my knowledge, no, it was only a forward roll station.
Thank you. Nothing further.
All right, thank you, ma'am. You can step down.
Thank you.
Any objection to this witness, please?
None from the state, Your Honor.
All right, and yours. The state calls the next witness.
State calls Catherine Brown.
Right through that gate, all the way through the gate. Okay, then go around this way. Make your way to the witness. Thank you.
I'm sorry, no, I asked for Catherine Brown. Yeah, you can step out, Ms. Brown.
Okay. Right here, please.
Can you please raise your right hand? Do you swear from the testimony you're about to give should be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Please lower your hand. You can have a seat. Can you please state your your first and last name and spell it, please.
Catherine Brown, Kathryn, Brown, Brown.
And Ms. Brown, how are you employed?
I'm a crime scene technician for Henry County Police Department.
And how long have you been a crime scene technician for Henry County Police Department?
For Henry County since 2010. Prior to that, I worked in DeKalb County from 2005.
And what are your duties as a crime scene tech?
Our unit is not like on television. We are not detectives. We are civilian personnel. And our duties are different depending on each scene, but they do include everything from photography, videos, sketching, collecting and processing for latent prints, the examination of latent prints, blood pattern analysis.
Anything else you do?
We do a lot. Let's see. We run APHIS and ULW, which are systems that are used to identify fingerprints within the lab, and we collect a lot of data, but we are not detectives. We do not do the interviews or the arrests.
At some point, did you become involved in the case of the state of Georgia versus Jennifer and Joseph Rosenbaum?
Yes, I did.
And how did you become involved in that case?
On November 24th, 2015, I was requested to go with Detective Witt for a follow-up.
And where did you have to go with Detective Witt?
175 Kendra Drive in McDonough, Georgia, gymnastics facility.
And do you know what was the purpose of you going to that gymnastics facility?
To document the appearance of the facility, to examine the equipment, and look at the area where the toddlers played or took classes.
And I'm showing what's been marked as States Exhibit 198 to 212. If you could flip through those and let me know if you recognize them.
Yes, I recognize them.
And do they fairly and accurately depict what you saw when you went out to the gym location?
Yes, ma'am.
Same as the States 198 through 212 be admitted into evidence. Yes. Okay. Let me show you what's been marked as States number 198. And if you could please describe what we're looking at in States 198.
All right. So we photographed the general appearance of the gymnastics area, and we also took photographs of the equipment that was used for the toddlers. And we took photographs with scales as well, so you could see the size and the distance off the ground of the items.
And which equipment are we looking at here?
This is a beam that's used for kids. It's about that high off the ground. It's basically just a long board that kids learn to walk and balance on.
What measurement are you taking in States 198?
It is 4 inches wide.
And what part of the beam is that?
The top.
And States number 199?
Okay, this would be another small beam, and the distance from the ground is 18 inches off of the ground.
And States Exhibit number 200?
Okay, another portion of the area, you can see the connected mats and other pads that they play on.
And States 201?
A little tight slide.
And States 202?
The distance to the top of the slide.
And what was that distance?
Let me look at my smaller one, see if I can, the one up close, if I may,
Okay.
or the actual
No,
photograph.
I have it. You want me to bring it up to
Yes,
you?
please. Thank you. Okay. So to the top of the blue area, that's about 36 inches right there. Thank you.
And States Exhibit 203?
Another photograph showing the general appearance of the room.
And States 204?
This is one of the bars that they had there.
And what appears to be underneath that bar?
Those are all pads.
States 205?
That's showing the width of the bar itself,
And what was that?
1.5.
And States 206? And if I need to bring it to you to see the measurement, I can.
If you would, please.
And
Thank
what
you,
were you
ma'am.
measuring in this?
Just the distance from the bar to the ground. Okay, 1, 2, 3. So it's about 3 foot 5 inches to the very top of the bar from the ground. And this is an adjustable bar too, so it could be lowered as well. But we photographed it in the position it was when we got there.
And States Exhibit 207, what are we looking at here?
The width of the base at the bottom of that.
And States Exhibit 208?
That's just simply showing mats again underneath the equipment.
And States 201. Is this the same bar or another bar?
I believe this is the same bar.
So State 204, would that be the same bar as the
Oh,
States
no, that's,
209?
my apologies, that's a different one. The mats are clearly different.
And I'm come a little bit closer so you can look at the measurements because I know it's difficult to see from there.
Thank you, ma'am. Looks like it's 3 foot 2 inches to the very top of the bar from the ground.
And states exhibit 209. I'm sorry, 210. What are we looking at there?
It looks like she's taking a measurement on the top
And it states 211.
and 1.5 inches approximately.
And states exhibit 212. And I'll probably have to bring it up to you.
And that would be the bar underneath it again, just the. Thank you. Looks like that's approximately 1.5 inches as well.
Thank you. Nothing further this time.
Sorry. You came to Gym Tech and photographed what you saw, correct?
I'm sorry, ma'am?
You photographed what you saw,
I photographed the general appearance of the toddler area.
but it's what you saw, correct? You didn't set it up.
That's correct, ma'am. It is how it was appeared when we arrived.
And in fact, the balance beam can be raised or lowered, isn't that true?
I'm not aware that the balance beam, the bars can.
You don't know whether the balance beam can or can't.
If you would like to enter, there's an image of the balance beam. There's a scale on it. We may be able to see if there's any kind of adjustments on it because you can see the metal portion below the beam.
If the owners testified that they can be raised and lowered, would that satisfy you that it could be raised and lowered?
I'm not aware of their testimony, ma'am. If you'd like to enter the photograph, we can certainly take a look at it.
Do you have a photograph?
I do.
Okay.
Would you like it?
Yes, please.
Here you go.
Let me show you what I would mark as Defense Exhibit 129. Ask you what that shows.
It shows one of the low beams that is approximately 18.5 inches off of the ground. And then you can see some of the support structure underneath it and the safety mats below it.
And is there anything definitive in this picture that shows whether it can be raised or lowered?
Not that I can see, ma'am.
Thank you.
So it appears to be stationary.
Nothing further.
All right, thank you.
Thank you. Thank you.
All right, please.
Yes, Officer.
Thank you.
The defense attorney's conversation on Gilmore. She asked
State
if
officer.
the witness
State
was
officer.
still nourished as if feeding her makes up for beating her to death.
What's the
Disgraceful.
last name?
McKee.
Sarah McKee.
Can you please raise your right hand? Do you swear or affirm the testimony you're about to give should be the truth and the whole truth, so help you God?
Yes.
Please lower your hand and state and spell your first and last name.
Sarah McKee, SarahMckee.
And Ms. McKee, I'll ask you to make sure you keep your voice up so everyone can hear you. And Ms. McKee, are you familiar with Gym Tech?
Yes, ma'am.
And how are you familiar with Gym Tech?
My daughter Macy was enrolled at Gym Tech.
And when was it that your daughter Macy was enrolled in Gym Tech?
We started in, I think it was October of 2015, and we, maybe a couple of months ago, stopped going.
And how old was Macy in 2015?
She was 4 at the time.
In the class that, what type of class was she attending at Gym Tech?
Just a pre-K gymnastics class.
And were there any other children involved in that class?
Yes, there was just one other child.
And do you recall who that child was?
Yes, her name is Millie.
And do you recall who would bring Millie to that class?
Her mother, Jennifer.
And when you say Jennifer, are you speaking of Jennifer Rosenbaum?
Yes.
And had you met Jennifer Rosenbaum prior to your daughter attending Gym Tech?
No, ma'am.
What days would your daughter have class?
I think it was on Mondays, Monday afternoons.
And was Millie always in the class with your daughter once she started in October?
Yes, ma'am.
And did you ever have any conversation with Jennifer Rosenbaum during, let me ask you first of all, while your daughter was in class, where would you be?
We would sit on a bench right in front of the class, maybe just a few feet away, a bench that was attached to the wall for parents to sit.
And would you be able to go onto the floor at all?
If necessary. I didn't, but if I needed to, for some reason, I could have.
And prior to your daughter signing up for the class, did you have to fill out any paperwork or do anything?
Yes, ma'am.
What do you recall having to fill out?
I'm sure it was our address information, probably any sort of questions about allergies or just information about my child, or I can't really remember, but I'm sure just a standard form of just basic information, things I may need to know.
Do you recall if you had to fill out any waivers?
Absolutely.
And when did you fill out that waiver?
I think immediately, whenever we signed up for the gym. I'm sure I had to sign a waiver before she was allowed to participate in anything.
I'm sure it's already been introduced into evidence states exhibit number 194. You can look behind you.
Okay.
Do you recognize that area?
Yes.
And what is that?
Just a parent waiting area.
Is that what you were describing when you said where you would be at during class?
Yes, ma'am.
And did you ever observe Jennifer Rosenbaum during those classes?
Yes, ma'am.
And where would she be?
We would normally sit together.
And would there be anyone else with you or Miss Rosenbaum?
Not normally. She had her other little girl with her.
Okay. And do you recall that other little girl's name?
Laila.
Okay. And what would Laila be doing while the girls were in class?
She would lay on the bench the entire time.
Did you ever see her out on the mats or participating in any class during the time you were there?
No.
Did you ever see her up walking around or running around the gym on equipment when class was not going on?
No.
Did you ever observe her out on the mats with Jennifer Rosenbaum playing on any of the equipment?
No, ma'am.
What would Laila's demeanor be during the time that the class was going on?
She seemed very maybe sleepy. Not like your typical child, I guess. Not rambunctious, not energetic, very tired. Maybe she would just lay down.
Did you ever mention her demeanor to the defendant, Jennifer Rosenbaum?
I did. I was, I guess, curious because it seemed peculiar to me. My daughter only being a few years older, I thought it was bizarre that she was so calm and kind of quiet. So I think I did ask her, is everything okay?
And did she respond to you?
She did. She explained that, well, I think at first she said, oh, she's always like this. She's just, I can take her anywhere. She's very calm and quiet. And yes, so.
Do you recall her telling you anything else about Laila?
Yes.
And let me ask you, was this the first time you had met Ms. Rosenbaum when you had this conversation or sometime later?
It's hard for me to remember. I don't remember if it was the first time or if it was the second time, but she did go into a little bit more detail kind of about her demeanor. I think I may have asked her again. I was just curious why she was so calm and quiet.
I would object to her feelings if she was curious or not curious in things she observed.
I think she can talk about her own feelings, Your Honor. And would you ever have any conversation outside of gym tech with Jennifer Rosenbaum?
No.
And you stated that you were curious about Laila's demeanor.
Yes, ma'am.
And did you further inquire about her demeanor?
I did.
And who did you ask about her demeanor?
I asked Jennifer.
And what did she tell you?
She said that she, I guess, described her behavior being that way because she was in an abusive home and that they were actually fostering to adopt her. So that it explained, I guess, her odd behavior.
Did you ever talk to Jennifer about Millie?
Well, very little. I did ask her at one point, why would she adopt a child who had been through so much when she already had a daughter of her own?
And what was her response to you?
She said that she had spent $25,000 on in vitro and that she didn't have $25,000 laying around to have more kids and she didn't want Millie to be by herself.
So were you under the impression as to whether or not Millie was adopted, a foster child, or her biological child?
That it was her biological child.
And you indicated that you asked her after everything that Laila had gone, a child who had gone through this. What was your understanding as to what Laila had gone through?
From what she explained, that Laila had been very terribly abused by her biological mother and I think boyfriend, maybe. I don't really remember, but that she had gone through some trauma and came from a really abusive home.
When you would see Laila, you said that she would lay on the bench. Did you ever see Laila walking around while she was at the gym?
No.
Did you have any other conversation with Jennifer while you would be at the gym?
We talked about mom stuff, just small talk about different things. I think I asked her if they were going trick-or-treating. We talked about stuff like that, but we did talk extensively. The class was an hour long, so we would talk the entire class each time.
Would she share anything with you about herself personally, Jennifer Rosenbaum?
Yes, ma'am. She told me just basic things, that she was an attorney and probably where she lived, or the area.
Anything else you can recall besides her telling you that she was an attorney?
We talked about discipline a little bit. She said that it seemed like she's very strict on her children. She said that we were actually talking about Halloween, and I asked if they would go trick-or-treating, and I made the comment that I didn't really like to give my kid candy because it would make her really hyper, and I can't exactly remember how the conversation went, but she did say something about how she made the girls run stairs, or run laps if they, I guess, misbehaved.
Did she tell you any other forms of discipline she would use?
I think that was all.
About how many classes do you recall attending, Millie attending and Macy attending?
I think it was maybe 4 or 5-ish, I think.
Did you ever observe any injuries or bruising on Millie at all?
Yes, ma'am, I did. I'm sorry?
Can you tell me about that and when it was?
Yes, ma'am. I don't exactly remember when. It seems like it would have been a few times after me meeting them. Millie had a bruise on her face, on her cheek, on her cheekbone area. And yeah.
Did you inquire about that bruise with anyone, to Jennifer or to Millie at all?
I'm trying to remember. Someone asked Millie what happened, and Millie just sort of paused and said that she fell. But she took a moment, and I noticed that she just looked right at Jennifer and paused, and then she finally said, "Yes, I fell."
And so was Jennifer present when you asked her about her face?
Yes, ma'am.
Is that the only time you noticed a bruise on Millie?
Yes, ma'am.
I want to back up for just a moment. When the defendant Jennifer Rosenbaum was telling you about Laila's history with the biological parents, did she give you any more information about whether her relationship with the biological parent?
Yes, ma'am. She stated that she was friends with she knew the biological mother, that they were in foster care together as children.
And how did she describe their relationship, if at all?
I don't think they had a relationship at all, but she definitely did not like her, from what I gathered. She did not say, she just said that it wasn't good. She wasn't a good mom.
Would Laila be present at all the classes that Millie attended when you were there?
I think so. I think all but maybe one.
Okay. And that one time, did you have any discussion with Jennifer about Laila's absence?
Yes, I did actually. I asked her, where was she? And she said that, I think she said she was with her dad, that she was having a difficult time potty training her, and seemed very, I guess, irritated about, like she kind of had enough or was frustrated with her, so that she wanted her dad to deal with her.
Do you recall which class that was? Was it first class or the last class?
It might have been in the middle. It definitely wasn't the first class.
At any point in time, did you observe any injuries on Laila?
Yes.
Can you tell me, if you can recall, when that was?
I think it was either the first or second time that I saw Laila. It must have been the second time, because she was laying on the bench, and my daughter had a little stuffed animal, and she asked Laila if she wanted to hold it while she, had her class, and she slid off the bench to, I guess, look at the little stuffed animal, and her shirt came up a little bit, and I could see all over her stomach, like bruising or red marks. Something was definitely wrong. Definitely had injury to her stomach.
And what part of the stomach was it that you saw?
I think it was kind of lower abdomen area, I think. I'm not really sure, but I want to say like maybe around her belly button and below.
And when you saw that redness, what did you do?
I know that I gasped, and I said, "Oh my gosh, what happened to her?"
Who were you asking that to?
Jennifer. And I was very concerned, and I think anybody would be. And I said, "Oh my gosh, is she okay? What happened?" And she proceeded to tell me that she had been abused terribly by the mother, that it went into detail about just very disturbing things that had been done, that she had been burned with really hot water, And, you know, so obviously something had happened, but I don't know.
So I want to make sure I understand you. She told you that Laila had been burned with hot water?
Yes, ma'am.
Did she go into any other details about any other types of abuse that she had received?
She said that, very disturbing. She said that the mother, or I guess the mother and maybe the boyfriend, I can't really remember. She did, anyway, she said that they would make Laila eat her poop when they changed her diaper, and if she wouldn't, she would pour boiling hot water on her abdomen and on her private parts.
Did she tell you anything else about the abuse that she believed Laila sustained by her biological parents?
I don't recall. I know that she said that she had a really hard time like changing her diapers and stuff like that after that, and that was why. I don't think that she said anything else about any other type of abuse.
At any point, did she tell you how long Laila had been in her care at that time?
No, I don't think she ever told me how long she had her.
During the time you were at Gym Tech, did you ever observe Laila doing a trial class or on the mats or participating in any way in the gymnastics that was going on?
No.
To your knowledge, did Laila ever participate in a trial class?
It seems like there was a time, I don't know if it was like right before we got to class one day, if it was prior to one of the classes, maybe a few minutes before, or if it was on a different day, but I know that when we came into the gym for our class, that there was, I remember Jennifer talking about how, maybe talking with one of the teachers about Laila, they were trying to get her to do one of the classes and she couldn't do it. She was crying the whole time and she could not do the trial class. That she did not finish it, or I don't know how long they were trying to do it, but she was upset and she couldn't do it.
Did you ever talk to Jennifer about Laila trying to do the trial class?
I don't recall asking her any questions about it, but I know that there was a little bit of a discussion. It was almost as if she was kind of just thinking out loud, maybe talking, saying that that maybe it was her leg bothering her and maybe that's why she couldn't do it. And she mentioned several times that her leg that it had bothered her, I guess, for a couple days, that she knew that the girls were outside doing gymnastics at home in the front yard and that Laila had fallen and that she wondered if maybe she had hurt her leg there.
Did you say anything to her about that statement that she made about Laila's leg already hurting?
I believe so. I believe I asked her, you know, are you going to take her to urgent care or take her somewhere?
Do you know if you made that statement to Ms. Rosenbaum?
Yes, I do.
Okay. And what was her response?
She said that, I can't remember verbatim, but she seemed very frustrated and did not want to do that. She made several comments about how she didn't like taking her to the doctor because they asked so many questions, that she always had to answer questions about the mom's abuse and that she didn't like going.
Did you have any response to those statements?
No, other than just me saying, well, are you going to take her? I mean, but no.
Did you observe Laila that day?
I mean, I noticed that she was there. I don't know. I don't remember anything specific, but she was there.
And when was the next time that you saw Jennifer Rosenbaum and Laila after that discussion?
I think it would have been the next class, like the following Monday.
And what did you observe, if anything, about Laila in that next class?
She did, in fact, have a cast on her leg.
Did you ask or inquire about the cast on her leg?
I don't think so. I think I just thought, okay, that makes sense.
Did Ms. Rosenbaum ever make mention to you about how she had hurt her leg to have a cast on?
No, not anything other than just that she had fallen, or she thought maybe she just fell in the front yard, and that's when it happened. Or she did say that she did fall in the front yard, and she was assuming that's when she hurt her leg.
Did she ever tell you that she had fallen at gymnastics?
No.
Did she ever tell you that she had fallen off of a beam at Gym Tech?
No.
Or a bar at Gym Tech?
No.
Had you ever observed Laila on a beam or a bar or a vault at Gym Tech?
No.
After you saw Laila with the cast on, did Millie continue to come to class?
I think she did. I don't know how many times it was after that, but she did.
And I think I asked you before about observing a bruise on Millie. Was that before Laila had the cast on or after that you saw that bruise to Millie's face?
I really don't recall. I'm sorry.
No, that's fine. After they came to class and Laila had the cast on, did Millie continue to come to class?
Well, I think, I don't remember how many times after that it was. Obviously, I would have seen her at a class if I saw Laila's cast. I don't remember if it was one time after that or if that was the last time. It doesn't seem like it was the last time, no. She would have had to have come to class again after that. Because I remember seeing Jennifer another time, and it was the last time I saw her.
And tell me about that last time you saw her.
Just that she was there, and she had a friend with her, and we didn't really speak that time. I just figured she was with a friend. So, and then that was the last time I saw her.
And you mentioned that the defendant, Jennifer Rosenbaum, indicated that Laila had been abused by her biological parents. Did she ever mention anything about abuse by prior foster parents?
No.
Your daughter, Macy, how long did she continue to take gymnastics?
For a few years after.
Has she ever had any injuries as a result of taking gymnastics?
No.
Was she ever injured while she was at Gym Tech?
Nope.
At some point, did you learn about the death of Laila Daniel?
I did eventually. I didn't know for a little while. I didn't know. In fact, I had asked one of the ladies there, if what was going on. I hadn't seen her in a while, and she didn't say anything. But eventually, I found out.
How did you find out?
I saw it on TV.
And what did you do when you saw it on the TV?
I was just very surprised, I guess, or very, I think anybody would be shocked, but it.
Wow, thanks, Tammy Morrell, Caligal 3, and Mama She 13. I actually went and got a bagel really quick. Came back, and boom, you guys are at the goal. You guys are awesome. Thank you so much. Appreciate
it. Very disturbing.
Did you ever speak to the police about your interactions with the defendant, Jennifer Rosenbaum, at Gym Tech?
Yes.
Do you recall when that was?
Oh, it was a little while after. I don't remember. It might have been like a month or so, maybe a little bit longer, before I spoke with anyone.
And how did you end up speaking with the police about your interactions with the defendant?
I felt like I had a moral responsibility to speak to someone because I felt like the things that we had discussed were not true, and it was bothering me really bad.
And what did you do at that point?
I spoke with a detective. I went and met with him and gave a statement on the things that I did know.
And were those the things that you shared with us today?
Yes, ma'am.
During that interaction with the detective, did you tell him about the injuries that you saw to Laila?
Yes, ma'am.
And do you recognize State's Exhibit 213?
Yes.
And how were you able to recognize it?
It was something that he had drawn or written in front of me and asked me to look at it.
I asked the State's Exhibit 213 be admitted into evidence. And can you tell us what we're looking at here in State's Exhibit 213?
It would have just been a sketch for us to both understand where I had described the seeing an injury to her abdomen area. I think he wanted to know a better idea of exactly, so he drew a picture, and we agreed that was the same place.
And so the arrow that's pointing that says injuries, was that drawn to indicate the area where you saw the injury?
Yes, ma'am.
And State's Exhibit number 45, is that consistent with where you saw the injury on Laila?
Yes, ma'am.
Another charge.
Ross.
In your statement to police, you said you saw a scar on the child's abdomen. Isn't that true?
I wasn't exactly sure what it was, to be honest. I saw redness. And
Let me
it
see
like,
if this would help refresh your recollection as to what you told the police.
I've read it. I know what it says.
And what does it say?
Let's see. I was able to see scars on her lower abdomen.
Nothing about redness, right?
Right. Not on that statement.
Bruises, right? Anything about bruises or redness?
Not on that paper, no.
Now, you went to see the detective yourself. They didn't come to you, correct?
Yes, that's correct.
You volunteered that on January 22nd, 2016, correct?
Yes, ma'am.
And you were friends with Laila's great aunt, isn't that correct?
No, we're not friends.
But you are Facebook friends, aren't you?
I mean, I recognized her name from something, and I reached out to her and asked her if there was someone that I could speak to. I did not tell her any details. We never talked personal information. I just said, I had some things I wanted to share with someone. Could she point me in the right direction? And I do not know her. We're not friends by any means.
So you would deny that you're friends with her on Facebook, where you comment on what she says and what you say to her?
Since we've been friends on Facebook, we've friended each other. On her personal Facebook page, if she posts a Bible scripture that I think is nice, I may comment and say that's nice, but we've never had coffee.
In fact, you're a member of Justice for Laila, aren't you, of the website Justice for Laila?
I may be. I'm not really on social media very often.
Let me see if this...
Ladies and gentlemen, we're going to take a 15-minute break and then come back. Thank you.
Because she didn't know whether to believe the child or not, because she told stories. She told lies, so the story changed all the time, so she did not feel like she could tell it. So I just wanted to put that to the court and make sure that the court has no problem with me going into that.
First judge, we would object to that because she had Tessa Daniel, who is the biological mother, on the stand on cross. If she believed that that was something that she had said, she had an opportunity to ask her about that at that time. Now to ask Samantha White about something that Tessa Daniel said would be hearsay. And furthermore, I would like to know what the defense is referring to, that they saw this information, because the state has not, I don't have anything that's dead on to what the defense is indicating the statement was made. So if we could at least be directed at what exactly she's talking about.
Okay, yeah, what I'm hearing, and just correct me if I'm wrong, is that that first of all, we're going to have Samantha White testify. Second, that as we discussed, there were a few forensic interviews. One of them we had agreed not to go into the substance of because it was unrelated to this case, except for the fact that there was a forensic interview. And it was a forensic interview of whom?
It was a forensic interview of Millie.
Of Millie. Okay.
Who said it was.
Well, that I understand. And that's what I thought you might be saying. That you wanted to extract from this, beyond what we discussed, something that Tessa said?
Yes, I got Tessa I think I've ability to recall her. So if the state's only objection is that I'm not asking it of Tessa, I can do so. I've noticed this in Ms. White's testimony and Ms. White's when we come out, and I've referred the court in the state to page 105 and 172 of DFCS records. And on there it said, caseworker informed the biological mother that the girls are in therapy due to allegations made by Millie. Caseworker stated that there was a forensic completed and that nothing was stated in the interview. She's aware of it. And then she said, she, talking about Tessa, is aware of the incident and says that it was a guy named Marcus who was the boyfriend of Cynthia Tate. She did not do anything about it because Millie's story would change, so she thought she was making it up, unquote.
And Judge, I don't just want to be really quick because I think we're mixing things up. There's several different incidents. This was a statement that was made in July 7th of 2015. A time before the children, that particular incident was a time before the children even went into care and was not the subject of that particular forensic interview. If I could just provide a little bit of foundation, when the children were placed with Ms. Brown made a statement to the case manager that she had observed the girls touching themselves and was concerned. And at that time, that's when these allegations, possibly someone by the name of Marcus, may have touched the girls at some previous time. And then that was the reason why they went forward with a forensic interview. I think to get into all of that, it would be confusing to the jury because it has really nothing to do with this particular case.
That's true.
But it goes to credibility of Millie and the fact that the mother says, on the stand, she said she doesn't lie. And here we have a statement from her saying that in fact she did not report her own child's child molestation because she couldn't count on the story being accurate.
And Judge, I would further say there are no sexual assault charges.
Stop for a second. I have to take this in and think about it. It seems to me the first thing is that it's not so much the forensic interview that's the issue. It's that the issue is whether or not Millie is always making consistent statements, and that's something that we've heard a lot already. I think that we both agree. True.
Yes, sir.
So it's not as though this is the only place from which to extract such information. And so when you're balancing the risk of confusing the jury with the set of unrelated and allegations against the benefit to the defense in extracting this additional piece of information without context, I think that the balance plays heavily in favor of the exclusion of that particular bit of information. But I'm not so sure that is the right lens through which to look at it, but certainly consider this analysis. Is there, and I'm sorry I stopped you, Ms. Young, is there anything else you want to add?
I'll stop there, Judge.
Nothing else?
Nothing else at this point.
All right, Ms. Fall.
Your Honor, I can ask it when I call the court commission force. I can ask it of Tessa. Tessa was asked because she tells lies, or she only tells little lies. She doesn't tell big lies. Well, this is a fairly enormous lie that what the state is wanting is to hide that fact that she her own mother does not report child molestation because she can't be sure that her daughter's not making it up.
I think that can be separated from the forensic hearing. In other words, you don't have to ask it through this witness, but instead you would recall Tessa for that purpose, and that would be, I suppose, I mean, arguably you had a chance to fully do a thorough and sifting cross-examination of Tessa already. But that would be the way I think to navigate this issue without complicating things too much. Does the state disagree?
No, Your Honor, and we'll cross that bridge. I think the state would have other issues if it came to that point, but I agree that this is the best way to move forward at this point.
At this point, all right. Is that acceptable?
That's acceptable.
Okay, let's see that. And if we could please call next witness.
Samantha White.
Just read apologize for the delay, but I can assure you we've been working. Let's go ahead and have Ms. White approach the witness.
Can you please raise your right hand? Do you swear affirm the testimony you're about to give should be the truth and the whole truth, so help you God?
Yes.
Please lower your hand and state and spell your first and last name.
Samantha White, and it's spelled Samantha, and last name White, White.
And Ms. White, how are you employed currently?
Currently, I work at a group home.
And how long have you been employed with that group home?
Since November.
And you have a really soft voice.
I'm sorry.
I ask you to speak up, pull the mic up, and keep your voice up, please.
Okay.
That's much better, yes.
Sorry about that.
And prior to working at this group home, where were you employed?
I was working at Mary Mac's Tea Room.
Okay, and prior to that?
Prior to that, Starbucks.
Let me go, 2015, where were you employed?
Henry County DFCS.
And how long had you been employed with Henry County DFCS in 2015?
For about 3 years. Would have been 3 years.
And what position did you hold while you were employed at DFCS?
Foster care case manager.
And tell me about your background that led you to DFCS. Your educational training and experience.
Okay, well, I graduated with my bachelor's in criminal justice. After that was really just college experience.
And prior to working for DFCS, what did you do?
I was still working with Starbucks.
Okay. And when you started working for DFCS, did you have any type of training?
Yes, I was sent to training.
And what type of training did you have?
Just foster care training, just going over rules and procedures, how to talk with children.
And how long was that training that you received from DFCS?
I'm not sure exactly how long it lasted, but it was different trainings that would usually last about a week long, each training.
And would you go through those week-long trainings over the course of your 3 years with DFCS?
Yes, it was done in the beginning.
And after you were complete your training, did you handle a caseload?
Yes, ma'am.
How many cases did you have on your caseload?
I'm not sure the exact number.
Average is fine.
Probably about 7 to 10.
And what was your responsibility? I'm sorry.
I said maybe more.
What were your responsibilities as to your caseload? What were your duties? What did you have to do?
I have to see the parent and the children and the foster parents once a month. If they were in school, check on them in school, see how they were doing with their grades. If they were in therapy, checking with their therapist to see how they were doing. Make sure they were going to their appointments.
Okay. And we've heard about various different units in DFCS. What unit were you considered to work in?
Foster care.
Okay. And was your caseload involving the children or the foster parent?
Both.
And was part of your job to provide resources to the foster parents?
No, it would be for the children.
If the foster parent needed resources, who would provide those?
I'm not sure who would provide them, but I could put them on the right path.
Who would you send them to?
They could go to OFI, like how the regular parents do. They had to fill out the same applications if assistance was needed.
Okay. And you talked about going over, I guess, rules and procedures with DFCS.
Yes, ma'am.
What rules and procedures in regards to corporal punishment did DFCS have?
We don't allow corporal punishment.
And what is the definition of corporal punishment by DFCS?
like physical force to discipline a child.
And was this information given to all foster parents?
Yes, ma'am.
And in regards to doctor's visits and hospital visits, who handled those?
It could be either the foster parent or the case manager.
And you mentioned school. Who handled, if the child was school age, who handled those responsibilities as far as the child going to school? Registration and all?
It would be shared. The foster parent could register. If they were unable to, the case manager would.
And then you said, I think you said therapy or counseling. Who would handle that?
The case manager.
And what all did that involve in handling counseling or therapy as a case manager?
I'm sorry, could you repeat that for me?
What all were your duties if you had someone that was involved in counseling or therapy? As a case manager, what would be your duties?
To send out the referral for therapy, a service authorization if it was needed, and just to check in with the therapist, see how the child is doing, to see if they need something more intense or if therapy was needed.
So if a child on your caseload was involved in therapy, would you have knowledge of that?
Yes, ma'am.
Would you have direct contact with that therapist or counselor?
Yes, ma'am.
And those therapy and counseling, where would those, if a child was in therapy or counseling, where would that occur?
What do you mean?
Would it be in an office? Would it be in a home? Or would it be in a facility? Like, where would those therapy sessions or counseling sessions occur?
It depends on the therapist, but they're usually done in the home.
And I want to move you forward to when dealing with, as a case manager, you dealt with the children, the foster parents. Who handled or worked with the biological parents if they were present?
That would be the case manager as well.
And what would be your duties as far as the biological parents or caregivers?
Well, for them, I would check in with them at least once a month as well to make sure that they are completing their case plan.
Did your responsibilities in regards to the biological parents involve visitations?
Yes, ma'am.
And how were those handled? As a case manager, how would you handle those as far as scheduling? Who would that go through?
That would go through the case manager, and sometimes it's contracted out if it has to be supervised. And then with that, we have to work with the person who will be supervising the visitation.
Let's talk about unsupervised visitations. If they're unsupervised visitations with the biological parent, how is scheduling of those handled?
Still, we just meet with the parent to come up with a good schedule, because sometimes you have to work around their work schedule.
And how would the foster parent, what part did the foster parent play in those schedulings?
If they're unsupervised, sometimes we can let the foster parent and the biological parent, depending on their relationship with each other, we can let them work together and coming up with a schedule that works for both of them.
And if they're supervised?
If they're supervised, it still would be the same. We can let them set up a schedule that works for them, but it also has to be, you have to have someone available to supervise the visit.
And would the foster parent ever be the person that, I guess, did the supervised visitations?
If they felt comfortable enough, they would be allowed to supervise the visit.
And if they did not, how would that be handled?
Then we would have someone supervise the visit for them, well, in place of them.
And who would DFCS normally use for those supervised visits?
We had people who were contracted with who could come in and supervise visits.
And if you had supervised visits, where would those visits occur?
They could occur out in the community or at the DFCS office.
And then in regards to, I guess, doctor visits and hospital visits or dental visits, what part did the case manager, as yourself as a case manager, play in assuring that the children, I guess, attended those different appointments?
Sometimes we can make the appointments, we can arrange the appointments, or the foster parent can make the appointments because it's also based on their schedule as well. If a foster parent is unable to take the child to the appointment, then the case manager will take them.
At some point in 2015, did your caseload include Millie Place and Laila Daniel?
Yes, ma'am.
How did you become the case manager for Millie Place and Laila Daniel?
They were assigned to me.
And do you recall when you were assigned their case?
It was sometime in April.
April of what year?
April of 2014, or 14 or 15.
With looking at
Not
something
sure.
help to refresh your recollection?
Yes, ma'am. April 2015.
And make sure you keep your voice up for me.
Yes, ma'am. 2015.
And at the time that Millie and Laila came into care, were they in placement?
Yes, ma'am.
Were they already in placement when you were assigned as their case manager?
Yes, ma'am.
And where were they in placement at?
They were placed with Miss Brown.
And as their case manager, were you aware of why they were in placement, why they were in DFCS custody?
Due to neglect and drug use.
Did any of their history indicate that there had been any history of physical abuse?
Not to my knowledge.
At the time that Millie and Laila were on your case plan, on your caseload, did you have contact with the biological parents?
Yes, ma'am.
Which parents did you have contact with?
Both the biological fathers and the biological mother.
Let's talk about the biological fathers.
Okay.
As to Millie, who was her biological father?
If
would it help you to look at something?
Yes, I honestly don't remember whose father was who. Yes, Jacob Place.
And what about Laila?
Mr. Anthony Daniels.
What contact, if any, did you have with Jacob Place?
I did have contact with Jacob Place. Once he was out, he would come in and he would meet with me at the DFCS office.
And you say once he was out, what do you mean?
Out of jail.
Okay. And he met with you where?
The DFCS office.
During the time that you were the caseworker for Millie Place, did Mr. Jacob Place have any visitations with Millie or Laila?
Visitations were arranged over supervised visits.
I'm sorry?
Yes, supervised visits.
Okay. And do you know how many times those visits occurred?
I do not remember how many.
Were those visits always supervised?
Yes.
Were you involved in supervising those visits?
No, we had someone sit in and supervise the visits.
Was it the foster parents that were supervising those visits?
They were allowed to supervise some of them, but in the beginning they started out at the DFCS office.
And what about Anthony Daniel? What contact did you have with him, if any?
Yes, I met with him as well. We would be at the DFCS office, and he was given visitation as well to supervise.
And Tessa Daniel, did you have contact with her?
Yes, ma'am.
Okay. And did she have visitations?
Yes, ma'am.
And were those visitations supervised or unsupervised?
Those were supervised as well.
And do you recall how many visitations she had?
I don't remember exactly how many.
At any point during the time that you were the caseworkers, was Tessa Daniel's visitations canceled by DFCS?
Well, yes.
Who canceled those visitations?
That would be through DFCS.
Okay. And what was the reason that DFCS canceled the visitations?
Because we were unable to contact her.
And I want to make sure that I understand the difference. Was it because were you stopping visitations where she could no longer have visitations, or unable to have visitations because she was not located?
It was because we were unable to locate her.
Was she ever located during the process in which you were the case manager in 2015?
Could you repeat that for me?
Had she ever been located during the time that you were their case manager in 2015?
Yes.
To your knowledge, did she ever go to any of the supervised visitations?
Yes.
How many times did she go to those supervised visitations?
I'm not sure how many, but she made at least a couple of them. Not sure exactly how many.
Did DFCS at any point ever stop or would not allow Tessa Daniel to have visitation with Millie Place or Laila Daniels?
No, ma'am.
Now, you said when the girls first came into care, they were with Ms. Brown.
Yes, ma'am.
Were you familiar with Ms. Brown at all?
Like, did I know her personally?
Did you know her? Had you ever placed any of your other children with her? Did you know anything about Ms. Brown prior to, I guess, Millie Place and Laila Daniel being placed in her home?
No, ma'am.
And as part of your duties, did you ever visit the girls when they were with Ms. Brown?
Yes, ma'am.
How many times would you say you visited the girls during the time they were placed with Ms. Brown?
I'm not sure exactly how many times, but probably like at least 4 or 5 times. You have to go out there once a month.
And when you would go out for visits once a month, what would you do?
I would go out, I would speak with Millie, sit with the girls, primarily speak with Millie because she was the one who was talking. And then I would also speak with Miss Brown to see how she was doing with the girls and if she needed anything from me and how they had been adjusting to the home.
And how were they adjusting to the home?
They were doing okay. Definitely wanting to be with family members.
And how did you know they wanted to be with family members?
Millie would often speak about wanting to be with her grandmother.
And who was her grandmother?
Miss Banks.
And was Millie having visits with Miss Banks during the time that they were in the home with Miss Brown?
Yes, ma'am.
Okay. How often would those visits occur?
About every week, if I'm not mistaken. I'm not sure.
And were those visits supervised visits or unsupervised visits?
They were unsupervised.
And how long would those visits last with Miss Banks?
Sometimes she would do day visits, and sometimes she would keep her overnight.
What about Laila? Was she having visits with Miss Peggy Banks?
Not during that time, no, ma'am.
And do you know why she was not having visits?
To my understanding, she didn't really have a connection with Laila. She had primarily been with Millie, and that's who she was doing her visits with.
And you said not at first. At some point during the time when the girls were with Miss Brown, did Miss Banks start to have visitation with Millie and Laila?
Not while they were with Miss Brown.
During the time they were with Miss Brown, we'll just ask, when Millie would come back from visits with Peggy while she was with Miss Brown, were there ever any concerns about abuse?
No, ma'am.
Did you ever receive any reports from anyone that the girls would return with any types of injuries or bruises when Millie would go visit with Miss Peggy Banks?
No, ma'am.
Take another step back too.
Okay.
When the girls were first placed with Miss Brown, when you went, did you go out to the home to visit?
Yes, ma'am.
Did you examine the girls per DFCS protocol?
Yes, ma'am.
Did you know any bruises or injuries of any nature on the girls when they first went into care into Miss Brown's home?
No, ma'am.
During the course of time while they were living with Miss Brown, did you ever observe any injuries on the children, on Millie Place or on Laila Daniel?
Not that I remember.
And would it help to refresh your recollection if you, I'm sorry?
I was like, nothing standing out to me right now.
Okay. Nothing that stood out to you at all?
Correct.
Okay. Besides Millie having visitations with Peggy Banks, did they have visitations with Tessa Daniel during that time?
I don't remember if that started while they were still with Miss Brown or not.
What about with Jacob Place or Anthony Daniel?
If I'm not mistaken, their visit started later.
During the time that Millie Place and Laila were with Miss Brown, were they going to doctor's appointments?
Yes, ma'am.
How were you made aware, or how do you know they were going to doctor's appointments?
Miss Brown would inform me, and I think with their first ones, I was actually the person who made their appointments.
And were they ever in school or daycare during the time that they were with Miss Brown?
No, ma'am.
Were they receiving any type of therapy or counseling while they were with Miss Brown?
If I'm not mistaken, they had started with Pathways.
And to your knowledge, how long did the sessions with Pathways last?
It wasn't long. Laila wasn't verbal, so she wasn't able to do therapy. And at the time, it was stated that Millie wouldn't need to continue.
That she what?
She wouldn't need to continue.
She wouldn't need to continue.
Correct.
Okay. So to your knowledge, after, I guess, how many sessions did they have?
With Millie, she probably had maybe like 1 or 2 sessions. She didn't have a lot.
And where did those sessions occur?
They were in the home, if I'm not mistaken.
In whose home?
The foster parents' home.
Which
I'm sorry. Would it have been Miss Brown or Miss Lambert?
And after those couple of sessions, did they continue to have any therapy to your knowledge?
No, ma'am.
And if they received therapy after those couple of sessions, would you have been aware of that?
Yes, ma'am.
During the time that the girls were with Miss Brown, were there ever any concerns about Millie lying?
I don't remember anything major about her lying. That sounds familiar, but I don't remember anything specific about her lying about something.
So nothing major?
Correct.
During the time that the girls were with Miss Brown, did they have visitations with anyone else? We talked about Miss Banks, Tessa, Jacob Place, Anthony Daniel. Was there anyone else that they were having visitations with?
No, ma'am.
At some point, did that change and they began to have visitations with someone else while they were with Miss Brown?
Oh, no, ma'am.
Do you know the Rosenbaums, Jennifer and Joseph Rosenbaum?
Yes, ma'am.
Okay. And how do you know them?
They became, caregivers for Millie and Laila.
When do you recall the Rosenbaums becoming involved with Millie Place and Laila Daniel?
I had received their phone number from a coworker.
And do you recall whose home they were living in at that time?
They were with Miss Lambert at that time, I believe.
And you said you received a phone call from a coworker?
Oh, I received her phone number from a coworker. They had, she had saw them while they were at court. Ms. Rosenbaum had saw them while they were at court.
And what did you do, if anything, with the phone number that you received?
I called and spoke with her. I told her that I was informed that she was interested in being a placement for the girls. So I got, her general information, name, address, how she knew the girls.
And what happened after you got all of that information?
I contacted the biological mother, Miss Tessa.
And what happened once you contacted Tessa?
I let her know that Ms. Rosenbaum had interest in being a placement for the girls. I asked her about their history together and if that's something that she would feel comfortable with.
And what happened after you had that conversation with Tessa Daniel?
Well, after speaking with her and she seemed to be okay with it, we started the process of screening.
And what's the process of screening?
We had to do background checks and a home evaluation.
And were those things done?
Yes, ma'am.
How long did that process take?
I'm not sure exactly how long it took. I would say maybe about a month.
During the time where the process was occurring for the Rosenbaums to I guess be a placement for the girls, were there visits that they would have?
Yes, ma'am.
Would those visits be supervised or unsupervised?
Their visits were unsupervised.
And how long would those visits last?
They started out as just day visits and then we worked our way up to overnight visits.
And at some point prior to the girls being placed with the Rosenbaums, did their placement move from Ms. Brown?
Yes, ma'am.
Do you recall how long the girls were in placement with Ms. Brown prior to them being moved?
I think about maybe 2 months.
And were you involved in moving the girls from their placement with Ms. Brown?
Yes, ma'am.
And where did they go after leaving Ms. Brown's home?
I'm with Ms. Lambert.
Prior to moving a child from one foster parent's home to another foster parent's home, is there anything that happens with the girls? Do they go anywhere in between?
They're usually at our office.
Okay. Is there any examinations of the girls done prior to them being placed in a new foster parent's home?
No, ma'am.
Did you observe Millie and Laila prior to them going into Ms. Lambert's home?
It would have been during their visit, but not like in between their move.
So was it, when you say their visits while they were with the Browns or their visits once they got to the Lamberts?
Well, I mean, it would be both. I'll say it would be done during their visit, like it wasn't done during their move.
Okay. So tell me about your visits with with Ms. Brown. At this point, are your visits done and complete when they're moving to Ms. Lambert?
Yes, ma'am.
How long after they are placed with Ms. Lambert is it before you go out to visit?
I know I saw them that day 'cause I was one who placed them with Ms. Lambert. I'm not sure when my actual visit was.
So when you say you were the ones who placed them with Ms. Lambert, did you take them to Ms. Lambert's home?
Yes, ma'am.
Did you observe the girls on the day that you took them to Ms. Lambert's home?
No, ma'am.
You didn't see them? Did you see the girls?
I saw them, yes, 'cause I dropped them off.
When you saw them, did you see any bruises or injuries on them?
Not that I remember.
Did you do a full examination or was just picking them up and dropping them off?
I was just dropping them off.
And once they got into did you know Ms. Lambert prior to the girls being placed in her home?
Yes, ma'am.
How did you know Ms. Lambert?
She was one of our foster parents, and I've had children placed with her before.
During the time that you had children placed with Ms. Lambert before, did you ever have any issues or concern about a child's safety with Ms. Lambert?
No, ma'am.
Did you ever have a child that was injured while in Ms. Lambert's care?
No, ma'am.
And do you recall how long Ms. Lambert had been a foster parent at that point?
I'm not sure.
Had she been a foster parent for the 3 years that you had been with DFCS?
Yes, ma'am.
Once the children went with Ms. Lambert, did they continue to have visitations with any family members?
Yes, ma'am.
Who were those family members?
She continued visitation with Ms. Banks, Ms. Tessa, Mr. Place, and Mr. Daniel.
And with Ms. Banks, were those still unsupervised visitations?
Yes, ma'am.
And with their the biological fathers, were they still supervised visitations?
Yes, ma'am.
What about Tessa Daniel? Were they having any visitations with her?
Yes.
Okay. And were those still supervised?
Yes, ma'am.
What about the Rosenbaums, the defendants? Were they still having visitations with them?
Yes, ma'am.
And the visitations that they were having with the Rosenbaums, where would those visitations occur?
I know sometimes they would have them at the McDonald's that was close by to Miss Lambert's home. Different stuff in the community, and sometimes at the home.
And how did those visitations appear to be going?
They seem to be going well.
And how often would they have those day visits?
I don't remember how often they were.
I'm sorry?
I don't remember how often they were.
And What about with Ms. Banks? Were they still having visitations with her?
Yes, ma'am.
Do you know how often they were?
No, ma'am.
Go ahead.
I was saying I wasn't sure how many she had, because during that point they were visiting with the parents as well.
So I'm going to start with the parents.
Okay.
When they would come back from visits, when I say them, Millie and Laila, did you ever receive any complaints from Ms. Lambert about there being any injuries or bruisings on the girls when they would come back from visits with Tessa Daniel, Jacob Place, or Anthony Daniel?
No, ma'am.
What about when they would come back from visits with Peggy Banks?
No, ma'am.
And at this time, was Peggy Banks having visitations with both girls or still just Millie?
She would visit with both. It was still primarily just Millie, but sometimes it would be Millie and Laila.
And in regards to the Rosenbaums, did you ever receive any complaints from Ms. Lambert about concerns or bruises or injuries that the girls would return with?
Yes, ma'am.
About how many times did you receive complaints from Ms. Lambert about injuries to the girls when they would return from visitation with the Rosenbaums?
It's only one incident that comes to mind where she was really concerned.
And tell me about that incident.
They had came back from a visit. She had taken pictures and she had brought them up to the office because she was concerned about there was little marks on Millie's leg, I believe. I think it was Millie's.
And I'm showing you what's been already attempted to state's evidence, state's exhibit number 121, and it's behind you. 120. And who's that a photograph of?
I want to say that's Millie.
Make sure you keep your voice up.
I'm sorry, I'm trying to look and talk at the same time. I want to say that's Millie, I believe.
And state's exhibit number 119. Who's that?
That's Laila.
And was this one of the photographs that she brought to the office? Ms. Lambert?
I believe so.
Do you recall when that was that she brought those photographs to the office in regards to her concerns about injuries to the girls?
I'm not sure exactly what date it was.
And looking at a document help to refresh your recollection as to that date?
Yes, ma'am.
You can look through that and see if they actually refresh your recollection as to the dates.
Let's disable this. I think this is it. I think that's the same one. I think it's July 9th.
After Ms. Lambert expressed her concerns, what did you do as a caseworker?
Well, once the pictures were given to me, I spoke with Miss Brown about her concerns.
Ms. Brown or Ms.
I'm sorry, Miss Lambert.
And what did Ms. Lambert express to you in regards to her concerns?
And she felt like it was a matter of supervision.
Did you do anything else in regards to Ms. Lambert's concerns?
Honestly, just addressed the issue. Just spoke with both parties. I spoke with Ms. Lambert and got her concerns. Discussed it with my supervisor and had a conversation with Ms. Rosenbaum.
And what, if anything, did Ms. Rosenbaum say to you when you expressed your concerns?
She was receptive of it. I didn't receive any pushback.
Was there anything else that you did in regards to that issue?
No, ma'am.
After, at some point were the girls placed with the Rosenbaums?
Yes, ma'am.
How long after the complaints by Ms. Lambert, how much time passed between the complaints of Ms. Lambert and the girls being placed with the Rosenbaums?
May have been a few weeks.
During the time that the girls were with Ms. Lambert, outside of the indication she's made about bruises that were coming back, the girls were coming back with after visits with the Rosenbaums, did you observe any other bruises or injuries to the children?
While with Ms. Lambert, no.
At some point in time, how do you know that the girls are now being placed with the Rosenbaums? Who made that decision? How did that decision happen?
We were actually instructed by our judge to move them.
And what judge is that, if you remember?
I'm not sure which one it was.
Was it, at that time, was the plan to place the girls with the Rosenbaums? Let me ask, after Ms. Lambert's complaint, what was the plan as far as visitation and placement with the Rosenbaums with defects?
We were going to continue the visitation just to give more time to, I guess, learn how to better manage the children in regards to like supervision and making sure they're playing safe. Yes.
And were there any, I guess, resources or anything of that nature provided to the defendants as far as supervision and dealing with the kids after having the complaints by Ms. Lambert?
Nothing was put in place, but I do know Ms. Lambert offered her assistance. She could call her whenever she needed help or advice about something.
And to your knowledge, did that ever occur?
Yes, they had open communication.
And you said at some point you got an order for the children to be placed?
Yes, ma'am.
And who removed the children from Ms. Lambert's home to take them to the Rosenbaum's home?
That would be me.
And did you observe the children on the day that you removed them from Ms. Lambert's home?
Oh, yes, I saw them.
Okay. And did you observe any marks, injuries, or bruises on them?
Not that I remember.
And during the time, do you recall what day it was that the girls were placed with the Rosenbaums?
I don't remember exactly what the exact day it was now.
And I want to back up a bit. When they were with the Lamberts, you said they had overnight visits.
Yes, ma'am.
How long would those overnight visits last?
They would usually be on the weekends. It's like a Friday and Saturday. They would usually come back Sunday.
So what day would they pick up?
It would be Friday.
And what day would they drop off?
Sunday.
Would they go back to Ms. Lambert's house in between that Friday and that Sunday?
No, they would usually have them for the overnight.
For the entire weekend?
Mm-hmm.
So once they get to the Rosenbaum's home, who's having visitations?
That would still be the biological parents and Miss Bank.
And how often are those visitations occurring?
The visits are supposed to be once a week. Honestly, as often as we could have them. Just depends on if the parents were available.
Okay. Now let me just ask you, when the Rosenbaums were having visits, when the girls were with the Lamberts, did you ever receive any complaints or concerns raised by either Jennifer Rosenbaum or Joseph Rosenbaum that when they would get the kids from either Miss Lambert or Miss Brown, that they would have injuries, bruisings, or anything of that nature?
Not that I remember.
And if there were complaints or concerns raised by the Rosenbaum, would you have noted it in the defects records?
I would think so, yes, ma'am.
Okay. And have you had an opportunity to go over the defects records during that course of time?
Yes, ma'am.
Did you see any notation where the defendants were raising concerns about injuries when the girls were with the Browns or with the Lamberts?
No, ma'am.
Now, when Millie was, I'm sorry, I'm bouncing all this a lot. When Millie was with the Lamberts, did Ms. Lambert ever raise any concerns about Millie lying?
Not that I remember, I'm not sure.
When the girls were with Ms. Lambert, did they continue with the therapy that they were having with Pathways?
I'm honestly not sure if it has stopped by then, because I know they had just started, but I know they didn't continue for long. So possibly.
To your knowledge, were they still having counseling on September the 24th of 2015?
I don't believe so.
And if there was a notation in the DFCS records concerning counseling on September the 24th of 2015, what would that be in regards to?
That could be just something that they have completed already, or that they have done and may not be doing it now. Maybe just like a summary.
A summary of, I guess, services they've received since coming into custody?
Yes, ma'am.
And is your supervisor, who was your supervisor at that time?
Ms. Tamara Warner.
And does Ms. Warner, does she have direct contact with the girls as your supervisor?
She can.
Okay. Did she have direct contact with the girls as your supervisor? Let me ask it a different way.
I'm not sure.
Was Ms. Warner responsible for making any scheduled appointments, counseling, doctor's appointments for the girls at all?
No, ma'am.
If she received any information about any therapy or any doctor's appointments, where would she get that information from?
It would come from me.
During the course of time when the girls were with Ms. Lambert, did you have occasion to visit them in the Lambert's home?
Yes, ma'am.
And how did they appear?
They seem fine. Like, normal.
Did you ever have any concerns about their safety during the time they were with Ms. Lambert?
No, ma'am.
Did you ever observe any bruising or injury during the time when they were with Ms. Lambert?
Just the ones that were pointed out, nothing other than the ones that we discussed.
And would you do any examination of the girls when they were with Ms. Lambert?
Yes, ma'am.
And who would you examine, and how would you do that examination?
Well, with Laila, I would undress her, since she was nonverbal, so I would undress her. Millie, I would examine her as well. Just looking her over, seeing if she had any marks or anything.
And did you ever, when you undress the girls, did you ever find any injuries of any kind?
No, ma'am.
And I'm showing you State's exhibit number 45. This mark right here on Layla's stomach. Did you ever observe that during the time that she was with the Lamberts?
No, ma'am. No, ma'am.
Once the girls were in the home with the Rosenbaums, how often would you see them or visit with them?
I would visit them once a month, but I would see them often.
During the times that you would see them or visit them, would Ms. Rosenbaum ever raise, or Mr. Rosenbaum ever raise any concerns that they might have?
As far as
the girls?
Yeah, if they had any concerns, they were good about noting them or speaking to me about them.
Did they ever raise any concerns about Millie lying?
I honestly don't remember any huge issue about lying.
Did they ever raise any concerns about Laila having any rage issues or behavior issues?
Laila could get upset. That was a issue prior to them being placed.
Okay. And in regards to the Rosenbaums, did they ever raise that as a concern?
I don't remember having a conversation about it.
Do you recall the Rosenbaums ever raising a concern about Laila and her holding her breath or gasping for air?
No, ma'am.
Did you recall them ever raising any health issues or concerns they may have had for either one of the girls?
No, ma'am.
When the girls were with the Rosenbaums, how would you and the defendants communicate?
We communicated over the phone, through text message, in person.
Did you ever receive photographs of the girls from the Rosenbaum?
Yes, ma'am.
Was that unusual for a foster parent to send you pictures of the kids that were in their home?
No, ma'am. Some would, some wouldn't.
And what types of photographs would you get of the girls from? First of all, were they coming from Jennifer Rosenbaum or Joseph Rosenbaum?
Miss Rosenbaum.
Who would you say you had the most contact with out of the Rosenbaums?
Miss Rosenbaum.
Did you ever meet Mr. Rosenbaum?
Yes, sir. Yes, ma'am.
And about how many times did you meet him?
I'm not sure how many times I met him, but it'd been a few times.
And on what occasions and where would you have met him?
We've met at my office, and I've met him a couple of times. He would be at home sometimes when I come by.
And when you would visit in their homes or when you would receive pictures of the girls, how did they appear?
They look to be happy.
During the time that the girls were in placement with the defendants, were they receiving any type of counseling?
I don't believe so.
And if they were receiving counseling, who would have set that up or scheduled those counseling appointments?
I would have been the one to arrange them.
Do you recall ever setting up or scheduling any counseling appointments?
Not that I remember. I think the counseling had ended by then.
Can you speak up just a little bit?
Yeah, still too low. I'm sorry. Do I need to repeat it?
During the time that the girls were with the Rosenbaums, to your knowledge, did they ever go on any trips?
Yes, ma'am.
Okay, where did they go on a trip to, or trips to?
I know one time they went out of town for a wedding. I believe it was Dakota. I think it was only out of town visit.
And how did you know that the girls had gone on that trip?
I just had to get approval to go out of state.
Outside of getting approval, did you get anything else to confirm that they had gone on that trip?
Not that I remember, just that they were going, the dates that they were going to be gone.
Did you ever see receive any photographs from that trip?
I don't remember if I received photos from that trip or not.
Did you ever talk to Millie about that trip?
I don't remember discussing the trip.
During the time, and if you need to look at the records, I can let you look at it. Do you recall having a visit with the Rosenbaums on August the 5th of 2015?
I'm sure. I'm not sure.
Do you need to look at the records?
Yes, I'm not sure that's the exact date, but I'm sure I saw them in August. Okay, but that's the 19th. I was looking at the wrong date. Okay.
Do you recall that visit on August the 5th?
Yes, ma'am.
And where was that visit at?
This was done at the home. With the Rosenbaums, I'm sorry.
And at that time, did you visit with the children?
Yes, ma'am.
And tell me about what you did during that visit and what you observed.
Let's see, we discussed.
And if you could just look at it once you refresh your recollection, then look up, don't read from the document.
Okay.
Does that help you refresh your recollection as to that visit on the 5th?
Yes, ma'am.
Okay, and what did you do and what did you observe?
My job would come in, come in, greet everyone. I would usually speak with Ms. Rosenbaum first, and then I would speak with the girls separately. And during this time, we were discussing, schooling, getting the girls into daycare. So she was saying they were getting ready to enroll them at Ola Academy.
To your knowledge, had they been already enrolled?
I think she was in the process of getting them enrolled.
And that was on August the 5th?
Yes, ma'am.
Were you familiar with Ola Academy?
Wait, like that?
Had you ever heard of it? Did you know anything about it? And how were you familiar with Ola Academy?
Just heard about it. I didn't have a child there or anything.
After getting that information from Ms. Rosenbaum about enrolling in daycare, what else did you do during that visit?
just spoke with my usual routine, spoke with the girls. After speaking with Ms. Rosenbaum, I'll speak with them privately. Speak with Millie. Laila would be there. I would undress and check Laila. I would always look over Millie and just talk with them and see how they're doing, how they're adjusting, how they're getting along with them.
And when you undressed Laila, did you find any injuries or bruises on her?
With Laila, no.
What about with Millie?
Millie had a small scratch that day.
When you saw that scratch, what did you do, if anything?
I asked about it, asked what had happened.
And what did she tell you?
That she had fell while they were playing around the pool. And she had fell and scraped her head.
And who's giving you this information? Is it Millie or the defendant, Jennifer Rosenbaum?
If I'm not mistaken, that one came from Ms. Rosenbaum.
And that injury that you saw, is it different from the injuries that were depicted in State's Exhibits 121 and 120? The injury that you saw on August the 5th, was it different from these injuries?
It was on her. It was on her forehead.
Did you speak to Millie at all about the scratch on her forehead?
I believe I'm sure I did.
Would you have noted it in your records?
Yes, ma'am.
If you could look to see if you did.
Okay, I didn't.
And what did Millie tell you?
No, I was saying I didn't.
You did not? Okay.
Yes, ma'am.
Okay. And I just want to go back. You said on the August the 5th, there was a discussion about daycare.
Yes, ma'am.
According to your records, were they already enrolled or were they being enrolled? If you could.
According to records, they were being enrolled.
And I just want to.
Yeah, they've been enrolled.
So were they being enrolled or had they been enrolled?
So she has been enrolled.
So, and where did you get that information that they had been enrolled in Ola Academy?
Ms. Rosenbaum.
Do you recall during the month of August whether or not you were ever informed by Ms. Rosenbaum about having, first, let me start with this one, that Laila had fallen down the stairs and had hurt herself and had injuries?
I do remember, I'm not sure if it was in August, but I do remember her telling me that Laila had fell on the stairs.
Let me ask you, was this before Laila had a cast or after Laila had a cast that she talked to you about her falling down the stairs?
This is why she had the cast.
Okay. Do you recall when she got her cast?
In October, I believe.
So in August, were there any reports of Laila having fallen down the stairs made to you?
Not that I remember.
Do you recall in August, specifically on August the 12th, Ms. Rosenbaum reporting to you having to take Laila to the hospital to receive IV due to a stomach virus?
I don't remember having to get an IV, no ma'am.
Are those types of things that should be reported to defects?
Yes, ma'am.
Okay. And to your knowledge and according to your records, were those things reported to you? And you can look through this.
Okay. No, ma'am. No, ma'am.
Let me ask you, as far as daycare is concerned, let me move forward. When do you recall your next visit being with the Rosenbaums?
It would have probably been in September.
And where would that visit have occurred?
At the home.
And that's the Rosenbaum's home?
Yes, ma'am.
Okay. And tell me about that visit. And if you need, would you need to look at your records to help refresh your recollection as to what I
remember all of our visits.
Let me just ask her, what do you stop?
It's going to be a while longer, judges, so we want to end for the evening, we can, because I have quite a bit more to go over with Ms. White.
Why don't we just take our break then now, and we'll come back tomorrow morning at 9 o'clock. Thank you for your work today, and we'll see you at 9 o'clock tomorrow morning. Okay, see you all tomorrow.
Thank you, Judge.
Yo, freaks. Hey, thank you guys very much. My builders here asking questions again, so I'll be back in just a second. But thank you guys for getting the goal today, and I hope you guys are. I think it's an interesting trial. I'm listening to it while I work on a video over here. But I'll be back in a minute. All right. There you go. There you go. I don't know if anybody's still here, but anyways, thanks again, everybody. And thank you to, let's see. Where are we going here? Members, Mama Sheet 13, Pico Pac Conco. Super Chats, K Mead, Deborah Blum Rogers, Mama Sheet 13, Pico Pac Daphne, Danielle, Tammy Morell, and Callie Gal 3. Thank you guys for reaching the goal. Appreciate it. And thank you for being here. And we'll be back tomorrow. And as I always say, everybody, until next time, be safe out there.
Drama! It's the house! Bitch, please!
Dude!
Ray is so mean!
Mr. Martinez, are you angry at me? 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 Mr. Martinez, are you